Hello.
Hello.
Nice
See
to
you.
meet you. It's a problem, no? No. I'm sorry.
Yeah. And this time you have to see it.
And you can sit wherever you like. Here in the front is fine.
Every month.
Yeah. Only once a year it's Bilbao because of the historic ties to Bilbao. Yes, it's
Yeah, I need one chair for the observers because there's no more chair.
Headquarters of the bank.
And we have one.
The real
I'm going to get one.
in this big building, very modern.
Just Paul.
so you know Aquinas,
So now
I know Torres,
Torres,
president, and I've been 2 or 3 times with the CEO.
Yeah.
The CEO. Cannot remember the name. Turk.
And in Turkey, the base is the largest bank.
Yeah.
But it's a
For
volatile
good,
market
for
to
good.
you know the author, what's her name?
be. Volatile thing to be.
She's in the. She's the program.
She's from Madrid.
Which the Turkish. Yes. Yeah.
Yes.
She's in the with a short.
Like, but every time you go, it's only one day.
Today's first. This one, yeah.
Coming in at midnight.
Oh,
So
yeah.
you spend the night. You spend the night.
Yeah. There's few flights from London, so they are arriving at
You can imagine a number of people making a note.
I don't know if through Brussels or through Frankfurt.
I was thinking for like opening a GA, she might be quite good for that.
Maybe. SAS or Iberia? Iberia. But apart this, you are involved in climate change. Outside the bank, yeah.
Yeah, but that was also the reason why when they asked Mexico to join the bank, they complained that they want to be very sustainable. And to see how it works in the real world. What do you do with one of your biggest clients in Mexico with the bank?
I'm now going to Mexico at the end of this month. It is 1 week for the meeting.
Good morning, everyone. Those still standing will take their seat. I'm sure you're all refreshed after the coffee break in that opening plenary. So welcome to our session today on health within the social contract that we've been discussing so far this morning. But before that, we're going to have an ideas sharing session on another topic, and I'd like to welcome Gaia Vince. She's an award-winning science writer, journalist, broadcaster, and author of Nomad Century, who will be our ideas sharer this morning. Gaia, go ahead.
Okay, I just realised I don't have a mic.
Just here, yes.
Hello, is this working?
Let me see.
It seems to be on. Okay, is someone technical here? Hello? Hello?
Okay,
Yeah, it's working. Okay. Hello, everyone. Bonjour. Thank you for joining. So this is a subject which is increasingly urgent, in my opinion, and outside, it's not very warm. The news came in yesterday that October was the warmest month in hundreds of thousands of years. This year has been extraordinary. If you look at the temperature rises with the red line, we are entering a new time. We had El Nino this year. It's called El Nino, the child, because it peaks at Christmas time. We're nowhere near Christmas yet, so we're going to see incredibly high temperatures and a load more extreme events coming through the Northern Hemisphere's winter and spring. This is hazardous to people. What we're seeing is an increase in heat waves, in drought, in chronic drought, in flash floods, in forest fires, in all the things that make life unlivable, which make crop harvests untenable and push food prices up. At the moment, we are living in a time of increasing numbers of conflicts. You cannot remove the impact of climate from everything, from energy prices to food prices to conflict to displacement. This was just outside London a year ago, forest fires. This is the UK, looks like Australia. The United States last year, Asia. What we're seeing increasingly is people being displaced. If we look at what happened in Pakistan last year, we have these cascading events occurring now where they had months of intense, extreme, unbearable heat. It was then followed by floods that made 33 million people. They were displaced within a week. That was then followed by infrastructure collapses, landslides, crop damage, which will last decades. This is the richest country in the world, just earlier this year. This is Australia last year. We are moving into a place where parts of the world are becoming increasingly unlivable. Now, we're here talking about European issues. Europe, of course, is part of a wider globe. This is a planetary problem. So just quickly to talk about, I'm not going to show you loads of these graphs, but to talk about where we are now. So October was 1.7 degrees above the pre-industrial average. Okay, that doesn't mean that globally that is now our new average temperature, but the idea of keeping 1.5 alive, I hope you realize now, is completely ludicrous. We've swept beyond that. We're going to be hitting 2 degrees by mid-century, most likely, and that makes the world increasingly unlivable. We need to be pragmatic. We need to be realistic. We need to realize that nowhere on Earth now can escape the negative impacts of climate change. It's not something that will happen in the future over there in poor countries. It's happening everywhere, but some places are much more impacted than others. So it's great news, not following the business as usual RCP 8.5 pathway, which, I mean, that's indescribably terrible by the end of the century. We're also not following the keeping below 2 degrees pathway, the 2.6 RCP. We're somewhere between 4.5 and 6, and as you can see, there is a high probability that we will be somewhere between 3 and 4 degrees by the end of the century. Now, that is very, very dangerous. What we can expect to see at these sorts of temperatures is multiple impacts. So what I call the 4 horsemen of the Anthropocene, the things that actually affect humans and livelihoods, the things we need to eat, crops. And as you can see, the major impacts are in the tropical regions, but it's not just a very thin band around the equator. We expect to see unlivability for months of the year, stretching all the way up, all the way down through the entire continent of Africa and up into southern Europe. Parts of southern Europe are already experiencing extreme effects. The lovely Mediterranean climate of Spain, of Portugal, of Greece, that has gone. We now have extreme temperatures there. We have desertification. It's a different world. So it's going right up there. You can see much of Asia, all of Australia pretty much, Latin America, South America, all the way down to Patagonia and the United States up into the Great Lakes. Okay, this means that people will have to move. We cannot, these are some of the most populated regions of the earth. So what's the big problem? So the 4 horsemen of the Anthropocene: fire, heat, floods, and drought are the things that push people to move. If I talk about heat alone, which as we put these invisible gases into the atmosphere, what they are doing, they're invisible to us, but they are opaque to the wavelength that heat travels in. So it's storing heat, and it's that extra heat energy which is driving these much more severe storms, which is driving these hotter temperatures, which is evaporating the moisture from the soils where it is held. So we have the drought, and then it is held in the atmosphere, and then we get these dramatic flash floods which do not replenish the soils and the agriculture, but instead course off and cause terrible soil erosion and infrastructure loss. So heat alone, we are mammals, we sweat to maintain our body temperature. We have to maintain a body temperature. When there is humidity in the air, our sweat doesn't evaporate, and that's when it becomes lethal. So we talk about wet bulb temperatures. Now, there is this so-called threshold of survivability, which is a wet bulb temperature. It was thought to be around 35 degrees, a wet bulb temperature of 35 degrees Celsius. It's basically measured in a very basic way. You just wrap a wet cloth around the bulb of a thermometer, and when it doesn't change temperature, you've reached that wet bulb temperature. And 35 degrees was, until recently, never experienced anywhere on Earth. It now obviously has been. And that's the temperature at which a healthy young person, not physically exerting themselves at all, will die within 6 hours. Now, that threshold of survivability has now been dropped through new research. It shows that it's somewhere between 25 and 28 degrees. And if I take you back to heat waves that we've experienced in Europe in 2003 when 30,000 people died, or 2010 when 50,000 people died in Russia, neither of those wet bulb temperatures exceeded 28 degrees. So I think you can see how lethal that is. And we are expecting that now. It's already exceeded in many places of the world. So we can adapt places. We need to be honest, and we need to be pragmatic. This is a post-climate change world now. Climate change is not something that will happen at some point. We are now living with that. But I think mentally, we have not reflected that in our policies, in our understanding, in our education system, our health system, our infrastructure, anything. We are not living. We may cognitively understand it, but we are not culturally or behaviorally or emotionally understanding. We now live in a very different world. It's a world of extremes, of uncertainty, and it's a much more dangerous world. We need to reflect that in all of our policy making. We can adapt places. If you look at places like Dubai or Phoenix, Arizona, people live in unlivable places, right? But they are living in heavily adapted, air-conditioned shopping malls. Everything they want. It's a small population, very wealthy population, and everything is brought to them. Energy, food, water, everything is imported. And if you go outside of that, say you're a construction worker, normally a climate refugee from other places in the global south, you are very likely to die from kidney failure, from heat stroke, from heart attack because of the unlivable conditions. So that's the reality. So just looking at 2 degrees, this is heat alone at 2 degrees at the end of the century. As you can see, we have a similar area being impacted as unlivable. It's slightly smaller. But remember, what we are expecting to see and what we are already seeing is not just more frequent and severe events, but these cascading events where one event leads to another. And what we are experiencing at the moment is discrete events. So one state or country will have one problem, disaster to deal with at a time. What we will be seeing within the next decade is multiple events within the same nation, within the same region. So people who are displaced will be multiply displaced, as they are already in places like Bangladesh, in places like Nepal, around the world. We see multiply displaced people. We're going to start seeing them more. A reminder of what we're experiencing. So, as you can see, there are regions of the world which are less affected, regions of the world which are better able to adapt to the increase in temperature for multiple reasons. Some because of better governance, more wealthy, because of lower reduced climate risk, greater land availability, all sorts of issues like that. Climate migration is underway. It is inevitable. The degree and scale is not. But we need to wake up to this reality. Yes, if we want to reduce the number of climate migrants that are forced to move, we need to invest in adaptation, heavily invest in adaptation right now in the most vulnerable nations. But we need to do it everywhere. There is no nation on earth that is actually adapting to the reality of what we face. Ignoring or believing that we can somehow push back people is not real, okay? It's not living, it's not acknowledging the situation that we face. We are in a different world. The borders that we have and the border policies, I should say, that we have are not compatible with a global crisis. Now, climate change is a threat multiplier. It increases all the other threats that people face. If we look at, for example, Syria, Iran, Iraq, that whole region, there was an attribution study that was out just this week, which showed that instead of once in 250-year drought events, severe drought events, they are now happening decadally or once every 5 years. That affects food prices, that affects conflict, that affects energy prices. You know, we cannot afford anywhere in Europe for the economy of China to go down because their hydro power doesn't work because of severe drought, which means productivity goes down, blackouts, etc., because we are all interlinked. This is not a problem for individual nations. This is a global problem, and we need to face up to it. We need to have pragmatic border policies. We need to realize that migration is not a security threat. At the moment, it is being handled by individual states, by their home offices, as a security issue. It is a labor issue, it is an economic issue, and of course it's a humanitarian issue as well. But primarily people are moving for work. We need to make this work. We need to look ahead and plan our policies And we need to plan everything, our infrastructure for a greater population in safer places. We need to plan where that industry is, where education facilities are. We need to manage this over the long term so that it isn't a crisis. Every time there is a disaster with an evacuation, that is a policy failure, right? Because most people living in those areas, you know, they are living in at-risk places. So, I don't know what the time is. How long have I got? Am I close to finish? Okay, I will very quickly say we need to, you know, when we expand. So I'll give you just 2 take-home points if I can, and one of them is that at the moment the idea of migration as understood and dealt with generally has been it's been the field of disaster experts, of social scientists, of politicians and economists, and I think people in that field understand that climate change is now a threat that might incrementally increase migration and might make it a bit more of might make it a bit more of a problem in the future. Climate scientists are working in a very different understanding, okay? Because the climate is not something which is incrementally getting worse. We are facing step changes. It means that we're not just going to see a few more storms. It means there is a shift, a systemic shift in the climate system, in the Earth systems. We are moving into a different, we're at the moment about to exceed 4 tipping points. One of them we've already exceeded, which is coral reef infrastructure, which means that coral reefs are doomed around the world. We also face the risk of the Greenland ice sheet melting, of the currents that drive the North Atlantic currents that drive the Gulf Stream. We are at tipping points, on the edge of tipping points of forest ecosystems like the Amazon. This is, you know, I don't know if this translates, the idea of the straw that broke the donkey's back, that you put more and more straws on, and then one straw goes on, the donkey's back breaks. That is a step change. You're moving from one state to another. If you take that straw off again, the donkey is not restored. You've moved into a different energy state. That's what's happening with the climate. And it means that migration is not going to just incrementally perhaps increase. It means that there is going to be a step change in the number of people affected, and that is a huge problem. At the moment, most people are moving to cities. Cities is where we need to focus our action. We are going to need to build entirely new cities and expand existing cities in safe areas. And we need to have policies that are pragmatic, that recognize this, and focus on meaningful ways to make it work for all concerned. And we are also facing a demographic crisis, of course, in the far north, where we're not having enough babies, support an aging population. We are expecting, a crash. If we didn't have immigration, we're expecting a crash similar to the impact of the plague in the Middle Ages. You know, a crash of about a third of the population. It's very serious. So, you know, this is Mumbai, for example. Can it adapt to degree changes of 3 degrees or more by the end of the century? Well, you know, this is where Mumbai is already a city of around perhaps 30 million people, some 9 million of whom live in slum housing, concrete boxes with corrugated iron roofs, where the temperature in each of these boxes is at least 6 degrees above the temperature in the city proper. Can you just adapt that? You know, it's also on the edge of the ocean, so it's getting all sorts of pollution problem. Yeah, okay, I have to go. But basically the answer is no, we cannot do that. This is a book of solutions. Please, borrow it from a library, read it, and think about, we need to start a conversation about how we handle this. I have to get my train. Thank you so much for listening. Appreciate it.
Thank you, Gaia. Thank you. Lots of food for thought there. Safe travels on your way back. I would ask our panelists to please join me on the stage now for our session. I will sit here. I will sit here. You can go there. Yeah. So, as you were all very well briefed earlier in the plenary by Dharmendra, we are all here today to discuss the 10 policy choices for a renewed social contract, as it says on the cover of your program. Those policy choices are available in publication on various places on site today, if you want to read more detail. But basically, this is the focus of our entire discussion today. Specifically in this session, you will see the title, Building Resilience, Strengthening the Social Agenda and Health for Societal Progress. And specifically in this session, we will be looking at policy recommendation number 6, asserting reducing inequality and improving social mobility as policy goals, and policy recommendation 7, engaging the private sector earlier as an actor for social good. Now, I don't have to remind anybody in this room of the old adage that good health is true wealth, and I think that that's a good kind of framing for our session today. We all saw how the COVID-19 pandemic underscored the crucial interconnection between health, well-being, and resilient societies, highlighting the significance of health for social cohesion, for justice, and a robust economy. In Europe in particular, ailing public health will increasingly pose financial burdens, whereas a healthy population can drive advancement. What we're going to be discussing today with our 4 panelists, all of whom are coming at this issue from different perspectives, is that intersection in terms of our healthcare systems, but also the social good and the resilience of our societies. So I'm very much looking forward to the discussion. But bear in mind, as I said, those policy recommendations when you're thinking of how you're going to contribute to our wider discussion after our initial speakers. So first of all, I would like to welcome Frank van den Broek, who's the Belgian Deputy Prime Minister and Minister for Health and Social Affairs. Frank, my question to you to open up the discussion. The EU's role in health has grown significantly in recent years, and the term resilience has been used a lot in this context. However, are we now ready for the next crisis?
Thank you for having me here. I think the answer is that we are slightly better prepared for some types of crises, like a repeat of COVID, but we're certainly not ready. And let me say that the introduction, I think, was absolutely spot on for this session, because I think we should be aware that we will be confronted with major, large-scale, transnational crises, much more than in the past. So that will be part of our life. And so we know from the COVID experience that to address such a large-scale crisis, you need both resilient welfare states, resilient health systems, say at the national and regional level, but you need also collective action at a higher level. You need international collective action, you need European collective action. And so to answer your question, I think at the level of the EU, pretty important initiatives have been taken in response to COVID. The European Health Union package, including, for instance, the creation of HERA, the Health Emergency Preparedness and Response Agency. However, and to cut short a longer discussion, I would say that whilst the promise of the European Health Union as posited by Ursula von der Leyen was broad and rightly so. So it was about the role of the EU in health and healthcare. So far it has focused very much on health security, on emergency preparedness. And that's too short. I think we know that you cannot dissociate health security, preparedness for emergency in a narrow sense, from the overall quality of your health and healthcare systems, the resilience of the systems, And you cannot dissociate that from the health status of people, because we know that a more healthy population is also simply more resilient. So we have to combine also at the level of EU action, preparedness. There's still a lot of work to do because the legacy is pretty messy, I should say, in terms of institutions and agencies that have been created. That's one issue, which we will address during the Belgian presidency of the EU, the first half of 2024. But we have to add to that also action at EU level on the resilience of our health systems and on the health status of our population. Let me just, for the sake of time, take one or two examples. We are preparing our Belgian presidency of the EU with a clustering of themes. One is about care, so healthcare. One is about preparedness, and one is about the security you need, for instance, with regard to the supply of medicines. I won't go into that, but that's a very, very, very urgent and difficult issue, which we are now really addressing at EU level, is about shortages of medicines. But coming back to care, just to take that point, I happen to think that not only all EU member states are confronted with a very structural problem of shortages of workforce, which is really structural. It's not only COVID, it's a structural issue linked very much to demographic aging. And I also happen to think that the development of strategies to cope with shortages of workforce should also be done at EU level. The EU has often been at the frontier. And it's both about innovation in the way you invest in your workforce, the way you organize your workforce. And there we have to really break a number of conservative resistances. It's also about technology. And we might discuss this. It's also about the kind of technology you can combine with innovation in processes to address shortages in the workforce. And there, I think the EU level is an excellent level for mutual learning, for supporting strategies. Let me finally say that the EU is also a pretty important legal player, because everything that's got to do with the recognition of professional qualifications, also for the health workforce, is EU competence. And one of the issues in the agenda, which we have put forward for the Belgian presidency from January onwards, one of the issues is that we also would like the Commission to reflect critically on the current legal framework with regard to mobility and recognition of professionals. Because that framework is an internal market framework. It's not exactly well equipped to accommodate the kind of dynamic evolution we need in terms of the organization of the workforce. It's not an easy issue, but that's really something we have to address, given also important competencies which are there at EU level. I'll stop here maybe, but that's the kind of reaction I immediately have on your question.
Thanks, Frank. Lots to consider there in terms of the forthcoming presidency. Turning to you next, Lubna Bouarfa, CEO and founder of Okra. As you mentioned in the plenary, you are a scientist by background and you work at that intersection of AI and healthcare right now. My question for you, Lubna, is what key trends and challenges do you see at that intersection of AI and healthcare that are likely to shape the future of the industry? And how can these be leveraged to strengthen social progress in healthcare?
Thank you, Mary. Since I started working with applying AI into healthcare back in 2007, building a kind of autopilot in the operating room, actually, as an early scientist, I realized the biggest barrier to bring AI into healthcare is human adoption. And if we look today, we're much ahead. AI is booming in different industries. And the biggest barrier for us is to really bring what we develop in the lab as AI digital solutions into healthcare to the practice, to the patients. We already proved in literature AI systems for detecting tumors, for breast cancer, for everything to do with imaging in dermatology, in ophthalmology is already not only fully automated, it's already outperforming the human in these sectors because it has the ability to learn from thousands of data. And why don't we already have those systems as standard care practices in our hospitals? I think if you ask me the trends are, I would describe it as innovator. Many innovators like me has seen these possibilities, how we can innovate healthcare, how we can create a healthcare system that doesn't wait for people to get sick, and that we can predict risks, that we can predict treatments that work, not only using the best data, that could be genomic and imaging, but even using simple data like transactional data, workflow data. That is our limitation right now. We can do all of this. I describe it as waves in the ocean, yeah? And this wave is getting bigger and bigger and bigger. But there is no shore where it's gonna splash. Actually, the shore is big rocks of data barriers, big rocks, high risk. Healthcare is high risk, let's regulate. Big rocks of every member state wants to have their sovereignty on healthcare. We don't want to share data. Well, healthcare is the place where we need more data. It's an evidence-based industry. Some diseases don't have enough samples in one country. So imagine these big waves is growing and growing and growing, and there is no ocean where it's going to splash. So what is going to happen? We already saw it happening before with the internet. Yeah, so this internet become and more people use it, and suddenly a lot of scammers on the internet, which created the big tech companies that came to solve the chaos. So this is going to happen again. I see it coming, very close. So we are at a crossroad. We have two choices, and the policymakers can choose which one. The biggest risk is to do nothing, because we know exactly what's going to happen because it's happened before. So we are at a crossroad. Either we're going to create a shore for this innovation where to splash. And that shore is what we call, as engineers, sandboxes. Open some hospitals in Europe for us. Share data with innovators. Let's start already bringing those systems, those diagnostic systems, those prevention systems, those computing risks. Let's start having them in a number of member states. Let's show that next to the standard care treatments with a doctor, these AI systems can do also a good job. Let's bring these results to Parliament, to member states, and convince everyone. Let's go to the patient. If we don't go to the patient, the big tech will go. Let's ask citizens to donate their data just like they donate their blood and their organs to create a unified, sovereign EU healthcare system that prevents us from getting sick, that doesn't wait for our population to get sick. That is number one. If we don't do anything, we know it's going to be an app and not governed by us. It's going to be maybe one, maybe two, where our children will go get free healthcare. They're going to talk to a doctor, we don't know which jurisdiction. They get medication prescribed from any jurisdiction. They can go to those labs, share their data. That will be the price. And we can't control how is data going to be used and selling more ads or even more other things. So we are at this crossroads, and I really urge the policymakers. The biggest risk is to do nothing at this stage. Thank you.
Thank you, Lubna, and thank you for injecting that sense of urgency to the discussion as well. We'll turn next to Nicolas Schmidt. Nicolas, you are the European Commissioner for Jobs and Social Rights. My question to you is, how can Europe further prioritize workforce issues and improve working conditions in a bid to enhance healthcare system resilience?
Yes, thank you. Thank you very much. I just wanted to say I was very much impressed by the previous presentation on climate change. We should really present that presentation everywhere, because there are still people who do not believe that climate change is a reality. Now, I think we are now confronted in the European Union with a general problem of labor shortage. And this is becoming one of the biggest issues for the future of our economies. Yesterday, there was a report presented in Germany on and one of the major problems of the German economy is labor shortage. We're limiting the growth potential in Germany, and this is something which is shared more or less by all member states in the Union. And when we are looking at the sectors, different sectors, there are many sectors affected by labor shortage and skills shortages, and obviously the care sector in general, and especially also the healthcare sector, is affected by this labor shortage, as Frank has already mentioned. Now, there are different approaches I think we can develop. First, I would say that we have to change a bit our health policies in that respect, because we have gone through a period where cost effectiveness in the care sector in general and also in the healthcare sector was priority. And we have reduced everywhere more or less the workforce. And labor conditions, working conditions, have worsened, sometimes dramatically. So in many cases, the attractiveness of this sector has been lowered. Second, I would say we have in many member states, I do not know about Belgium, a very strange system of education and training for people in healthcare. Very limited numbers, much lower, by the way, than the needs, or at least the objective needs. To enter faculty of medicine is not impossible, obviously, but it is more and more discouraging for many young people who would like to become doctors, but who fail because of all kinds of barriers to enter the faculties. So this is probably some kind of a protectionist way, or it's just to limit the numbers because of the cost consequences of that. So really we have to rethink the way how many people we train for these professions, really. And that's about doctors, but even about nurses. There is also the question how the distribution of responsibilities between doctors and nurses is organized. So sometimes nurses could do jobs which they cannot do for any reason. I would not enter the details, because they are reserved to doctors. So the organization, and Frank certainly knows much more about that, the organization in our health system could be also helpful. The third one, I would really approve what you have just said. I think there is a huge potential through technology, because this health or care in general, we consider this as sectors where productivity gains, and this is a horrible economic concept, but nevertheless it's useful. Productivity gains are not very huge. I think we get now the possibility. Said, artificial intelligence helps us a lot and is much more efficient than, because it can be based not on thousands or even millions of cases. So I think we have really to go that way. That's indispensable, not just to save a workforce, but also to make our system much more efficient, much more sure, and also to increase the preventive aspect of our health system, which is also something extremely crucial. The fourth one, certainly, if we have done all that, probably we need some kind of mobility. But in the care sector in general, including healthcare. But that's a very critical system, because if when we look already today, in Europe, you have more doctors with African origin than more or less in Africa itself. So there is an issue there which is very critical, because we can say, okay, we attract all kinds of doctors from third countries. Well, that's fine for Europe, but we have also to be aware of the consequences on the countries these people are coming from. The same thing, we see it now on the care system inside the European Union. We attract many, many people, mainly women, from parts of Europe where salaries are low, very discouraging, to the countries where salaries are not fantastic, but much higher. What happens? Well, they come, and they are replaced by people coming from outside the Union, be it Ukraine, Belarus, or other parts. So we have to manage this mobility in a fair way.
Okay.
And sometimes also this mobility helps to keep salaries down and labor conditions down also. And I think this is a big issue, how we have to restore the prestige, the recognition. It was one very important moment, that was the pandemic, everybody applauded, that's an essential profession. And now, well, I would not say this has been forgotten, but well, we have gone to business as usual again.
Right.
And I think with the recognition in our societies of these jobs is essential. Last word is?
Very
well,
last word.
Yeah. we are in a situation of big shifts in the labor market. Probably artificial intelligence will affect many professions. And there will be also reductions in labor force in sectors. And we have to organize these reductions and the shifts and the mobility from one sector to another, including to healthcare, to care in general. But this will only be possible and successful if the quality of work, if the recognition of work in these sectors can be improved and recognized in society at the level it should. Thank you.
Thank you, Nicholas, and particularly for opening up that multifaceted question of mobility, as you mentioned. Very interesting. We'll turn next and finally to Andrea Rapagliosi, who's the Senior Vice President of Public Affairs at Edwards Life Sciences. Andrea, my question for you, what solutions can the international private sector players like Edwards Life Sciences offer to alleviate healthcare workforce challenges and help standardize technological development and use across EU member states?
Good. That's really, we fly high. But let me, I like to be pragmatic, concrete. I think, as has been said, what the private sector is able to do is to produce innovation, right? Is our technological know-how and our contribution to society. That's really the element. Advancement in science, translated that in something that the same society can use, can apply. As the Minister Van der Broek clearly said, there is an innovation of products, technology, but there is also an innovation of processes. You cannot put, sometimes I used to say, the best, actually in Belgium would fit very well, the most modern, technological, fantastic bicycles so that you can have, I don't know, 100 grams of bicycles, you can change the speed with just simply thinking, etc. And midday on a Friday in the traffic jam of Rome, my hometown. It doesn't work. It doesn't work. You know, you cannot really make it happen or deliver on the expectation. So innovation is critical, but it's critical this combination. And I think that also innovation is no longer anymore an option. Maybe 10 years ago, we were still saying, do we need that approach or that therapeutic approach, or we can do differently, etc. Today is really a necessity to transform healthcare system. What has been referred about healthcare worker scarcity, there's an interesting study by Gupa Strategies in the Netherlands produced a couple of years ago. It says that to maintain, today in the Netherlands, 1 out of 7 people are healthcare workers today. If we want to maintain by 2040 the same, in the next 15 years, the same level of healthcare without changing processes, without change, the ratio goes 1 out of 4. So can you imagine that a system where you have in the Netherlands 4.5 million people working in the healthcare system? It's not even not conceivable, but not sustainable from any form of so it's there where the innovation should impact and should immediately bring inside in process. I use always 4 Ps to describe that. We need an innovation and system that are more preventive, inform better, are more predictable, and I think and predictive, if I may say so. So technologies that allowed us to understand the disease and the risk stratification in order to allocate better the resources upstream. These are the information that AI and many other systems, but also a model of early detection of disease, etc., can provide. Should be more personalized, customized on patient needs. but also personalized in sense of customized on local needs. More participatory, shared decision with patient allowed better choices and facilitate the process, and in a way more pragmatic in terms of evidence-based, but also making best use of all the data that Lubna was referring that we may have in terms of real-world evidences. You heard many times we collect an amount of data, but actually through the legislation that I see at the horizon arriving, it seems that rather than facilitate, I'm referring at the European Health Data Space, we introduce actually more barriers to the accessibility of this data. So in a way, we invest in generating more data, but then we complicate our life in having access for planification and for decision making. So just to make a very short, I think that innovation should be at the service of patients and healthcare workers, that's for sure, but actually the big changes, if we combine the best use, the innovation of processes, is also being at the service of efficiency and sustainability of healthcare system. That should be really the next steps at the next level of looking at innovation in healthcare.
Thank you very much, Andrea. So lots to chew on there from our four speakers. We're going to open up now to the room. And just a few rules of engagement before we do that, because the clock is against us, alas. So basically, you raise your hand to be given the floor. Please introduce yourself before speaking. And I would encourage you, no speeches, prioritize questions to the panel, or if you have specific recommendations in terms of those policy choices we mentioned before. I would also like to draw the attention to Sophie, who is our Debating Europe facilitator in the room, and she will be ensuring that citizens' perspectives are also part of the conversation. So, hands up, who would like to contribute? Okay, great. You were the first, I think. If you could introduce yourself and...
Thank you so much. My name is Thomas Alvin. I work at FBR, the European Federation of Pharmaceutical Industries. Great panel. So I have a very particular question. And I think the minister put it very well. You know, health resilience is much more than pandemic preparedness. We need to strengthen the overall health systems. And there are investment needs, and you all touched on some of them. At the same time, we see now health budgets contracting again, and you know, OECD has new numbers. We're getting to even below pre-COVID levels in real terms of health spending. So the money doesn't seem to be there, but we have investment needs. And usually this leads to just a cut of cost across health budgets, and we know that has a bad impact on health and the long-term outcomes. So how do we fix this? And because we all know that investments in health, where it's in AI, new therapies, workforce, it will take a long time to translate into better health outcomes for people. It's not the same year. It's in 5 years, it's in 10 years. Okay. So how do we create a new investment framework where we can invest knowing that we will not get a return this annual budget cycle, which is how most health ministries or finance ministries operate. So how do we get into a longer-term perspective on health finance?
Great. I'm going to take questions in batches of 3. So there was Kieran.
Kieran Devan, Coventry University, but I'm also the chair of the Irish Health and Social Care System. We began to touch on it. I would love to see the Commission take a lead on supporting the change in the model of healthcare, because we all live with systems which are aimed to fix you. You know, you need an antibiotic, you break a leg, you have a heart attack, you go into hospital, you get fixed, go home. But in the future, where life expectancy being what it is and where it's going, we will have a lot of people who will, we will not be able to be fixed. It'll be about how do we manage, increasing frailty. It strikes me that could be something that the Commission can take a lead on. How do we nudge systems to focus more on care in the community, not only prevention, but also that kind of how are we going to handle the frail elderly, because that's where the big volume will be, and all our systems are built around big buildings called hospitals. How do we get those services distributed? Thank you.
Thanks, Kieran. One last question in this batch, over here.
Thank you very much. I'm Brekena from the Lifelong Learning Platform, European Civil Society for Education and Training. I was a bit curious to hear a little bit more from you from one of the visions that we try to promote, which is to avoid this top-down policy making. We're talking about resilience, but most of your speeches were how to convince people to adopt something, how to train people to do something. So we are looking at citizens as someone or as people that are actually just impacted by what we decide and what we do for them, instead of what they are and what is their role in shaping what we are doing. When it comes to AI, for instance, where is the actual role of citizens in shaping it, in shaping the policy about them? So I think we have to question a little bit the way we do policy and the role that we give to citizens. So I would like to hear from you a little bit more of policy that is more people-centered and how we can change that, because we cannot bring people to education and training by forcing them. We cannot bring people to AI or whatever. Or we saw it during the pandemic with the vaccine. So we cannot just impose people's decisions.
Right. So first of all, I'm going to ask Nicholas to take Kieran's question first, and then we'll go to the rest of the panel. Nicholas.
Well, first I have to say that the Commission initially has not very much high level of competence in healthcare. That's the first point. We finally, I would say, due to the pandemic, suddenly became an important actor in healthcare or in health policies, because obviously pandemics need a broader and transborder approach. So, and now we are talking about a health union, by the way. We do not like to talk about the social union, but we are talking about the health union being part normally of a social union. So that's the first thing. And I think there is a need now, and also awareness, that we have to work much more between European countries in this area. Now, in this approach you define, we have started to give some reflections on care, how care should organize. Because we are talking about healthcare, but it's also long-term care for different categories. And here the Commission has made recommendation, because we have for competence reasons, how this care system could be organized. And there is one important issue also, which is the medical deserts. We have in many parts of Europe more and more, especially rural areas, no medical service. And here I think we, in our territorial approach, cohesion policy, this is one element where we have to think how to organize this. And here obviously also online medicine is of importance, because this gives new opportunities. My last point is also away from this which we need for different diseases and so on, but also more community-based. And here I think what we call the social economy can be a good solution, because they are social enterprises, small entities taking care of people, giving social care services. I think this is something we should develop, and this is in the framework of our recommendation and the action plan of social economy. So going in the direction of more community-based social services in general, including health and care services.
Thank you, Nicholas, and I'm glad that you raised the question of medical deserts, because actually they disproportionately affect older populations across Europe as well, as you mentioned, rural populations. Andrea, you wanted to come in terms of...
And I think thanks a lot for the bottom-up request. When I was playing with the 4 Ps, one is participatory. I think what we have experienced, and again are still, I would say, episodic, but when you engage, system that engage, process that engage, shared information with patient at the moment of the diagnosis through all the circuit of the treatment, system gaining in efficiency. You use less day, you have better outcome, you gain that type of time. So it's not only, it's nice to inform a patient. There's a project run, it's called Meet MEVA, but anyhow, it's funded by Europe by the European Union under the EUREGA program is the management of aortic stenosis in Catalonia they've done. And they measure how was managed this disease before, so they collect data, historical data obviously, the time between a diagnosis to treatment, the time before getting to the hospital, the time in the hospital. And when they started to introduce in this program, a full information at the diagnosis of the patient, how the patient, they were managing their health. So actually it became, it's not only, when I say participatory, it's not only directional or something nice to have. It's effective. It impacts the famous process innovation I was referring to. And there is here the chairman. I'm honored to be member of the board of the European Patient Safety Foundation. Pernilla is there, and I think they've done a lot on that field, and they should be recognized.
Great. I'm going to go back to the floor for another 3 interventions. As I said, comments, policy recommendations, or questions to the panelists. So this lady over here was first. Do we have a mic just over here? Yes. Yes, yes, we'll come back to that.
Thank you so much. I'm the person Andrea referred to. I'm the president of the European Patient Safety Foundation. And I think patient safety is something that we don't talk about that much as we should, because lack of training for healthcare professionals and lack of staff, of course, is a question about patient safety. And I do think that is a common way for the European countries to work together to really assure also that people like to stay in healthcare, to work there and feel that they are, you know, appreciated as any other members of society working in a successful environment, really, because healthcare is so much affected by everything. And I would like to take on also another hat that I have. I'm appointed by the European Commission, thank you, to be a member of the European Cancer Mission Board. And as maybe some of you know, that we have a European Cancer Plan. And it's assigned by all countries in the European Union to really work with and for implementing the cancer plan. And it's a good example, I think, that we should spread also to other areas of healthcare, because it's one mission, but it's also 4 other missions were appointed at the same time for climate and environmental changes, and how cancer in this particular area is also affected by this. So we can connect all the things together to have a more sustainable European Union. And of course, that will also affect the other countries around. So together we can do it, I will say.
Okay, great. And over here, Mike.
I'm Oana Tsoiu, former chairwoman in the Romanian Parliament of the Labour and Social Protection Committee. I have a question based on Commissioner Schmidt's input on the social services connected to healthcare. In my country and in parts of Europe, a century ago, if you would be sick, sometimes the doctor would prescribe a month in the sun, walk in the forest, go closer to the seaside. I'm not saying go back in time, but I'm saying there are some lessons there in the ecosystem around the patient and the potential patient. Nutrition, sports, access to nature. And my practical question to that is, what do you see at the national or European level in the future as mechanisms to be able to finance that? As mechanisms to be able to train professionals in this more multidisciplinary approach where movement, social interaction, nutrition, the environment around are used as instruments for better health outcomes connected to the healthcare system as we recognize it to be today.
Thank you. And another hand, just here, this lady here.
Thank you. So, just a question about, I agree with all what was said about the importance of the offer of social and health services, and especially the health desert. But in addition to that, I would like to know, in the perspective of the new cycle, European cycle, How do you feel, or how do you envisage the link between the offer and what economists call care economy as a parameter of define and also to allocate resources to health services globally? So is care economy something just for the economist, or people from health system and health responsibility are part of in order to define new parameters for social and health care globally, especially the fact that care economy is a gender-based economy, especially for women. So that's also something which could be important in this perspective.
Okay, back to you, Frank, in terms of the health budget question earlier.
Yes, yeah, thank you. I'd like to address several questions that have been raised. First of all, I agree with Thomas that we badly need to be convinced everywhere that you have to invest sufficiently in health and healthcare. I'm working on that message at EU level, at OECD level. There will be an important ministerial in January at OECD level, which I have the privilege to chair. I will drive that message home there also. We have to invest sufficiently in healthcare. There is a particular difficulty at EU level because the fiscal governance, the economic and fiscal governance of the EU, as it is being discussed right now, does not seem to give sufficient leeway to this kind of investment because it's simply accounted as a cost factor and not as a productive investment. We are discussing this. During the Belgian presidency, there will be a joint meeting, we call that a jumbo council meeting of the finance ministers, the economics ministers, the social affairs ministers, and the employment ministers. So we will organize that on the 12th of March of next year. So there will be a jumbo meeting of the finance minister, the economics, the ECOFIN filière, and the EBSCO filière. And me and a number of colleagues, we are preparing that by really working on that argument, that investment, intelligent, well-organized investment in social policy, but also in healthcare, is a productive asset and we should be able to continue that kind of investment also in the framework of the EU's new economic government. So that will be a very important debate. However, I would also like to say the message is invest and reform. And let me come back a little bit, if I may, to what Nicola said. Nicola, we are investing in healthcare. If I take the salary of someone who starts in the Belgian healthcare system, a starter, a nurse, or even a clerk, we increase the salary of a starter beyond price indexation, so in real terms by 11–12% if you compare today's starting salary with 3–4 years ago. So their salaries are not reduced. Huh? We increased them very significantly. Secondly, the number of staff over the last 10 years has been increased significantly. So we do invest, and we should invest, and it should happen everywhere, I agree. However, the pressure on the system is such, for fundamental sociological and demographic reasons, that will not solve the problem. So we must reform, and we need thorough reform. Indeed, for instance, AI can be extremely helpful. You can replace radiologists. We will have shortages for radiologists in a few years' time. But you can replace them and do a better job. Now, and there I come, and if I may, I'll stop there. I come to the Irish representative of the health and care sector. Yes, indeed, I do believe that the EU can be at the frontier of thinking about reform. And that's exactly what we want. And then we will take on board, this is part of our program, the lady that mentioned the EU's Beating Cancer plan. We want a stock-taking exercise because there's more to do on cancer. We want a stock-taking exercise on the EU Beating Cancer plan. But also we want to use that as an example how you can work indeed also on healthy lifestyle, because I won't go in all the aspects of the healthy lifestyle you mentioned, but contrary to what people may think, the EU has important legal competencies in domains where we are about lifestyle, tobacco, alcohol, you name it.
I wanted to bring Lubna in here because
Okay.
the clock again
I
is
stop
against
here.
us. Lubna.
Well, thank you. And I think if we hear many questions and also many insights here is linked to actually solutions that we can already implement today with the technology we have. So the efficiency elements, we are the capacity problem, and we know that actually as an engineer, I would recommend that as step one, phase one, let's use AI and technology to drive efficiencies, patient triage, serious cases to specialists, non-serious cases in a different pathway. Let's address the efficiency. The data sensitivity there is less of a problem, and we can already implement it. And still we have the human in the loop. While we are executing phase one, let's have a phase two, where we're actually addressing the bottom-up approach, bringing the patients, making them part of this. They own their health data. So instead of trying to build big initiatives, and I'm so excited by the European health data space, but we've been talking about it for 4 years. Where is it? So really making the patients part of this and having this AU health app. Let's call her, we called her in Berlin, in Dublin, Sarah, for example. Let's get the patients part of this, donating their data to train the system and already open some hospitals in Europe to be the sandbox environment. Next to the normal workflow, to have the AI just to check a Turing test. How good is the AI in the radiology, in dermatology, in ophthalmology? And then just bring the facts. If we don't get the facts, even if we tested those systems in the lab, let's get them to run in reality. That will be phase two as an engineer. Getting the facts, getting the data, and then making the decisions. When to go live, how to go live, launches, which countries, which member states will be part of that. And then number three, and then come the holistic. Then we go beyond data about managing disease and preventing disease, but also monitoring, and we're bringing what we always had, nutrition, physical activity, and we are driving this dream.
I know, Frank and Nicholas, you want to come back, but I'm going to go back to the floor for the moment for another batch of 3 interventions. So hands up, I see a hand back here, and another one over here. So the mic here first, please.
Thank you very much. My name is Anna Knoll. I'm working at ECDPM at the Migration and Mobility team. It's a think tank focusing on global development issues. My question is to Nicolas or Frank. You mentioned the need to also look at mobility and migration to some extent. So my first question, with all the measures relatively seen, how important is that component next to, replacing maybe radiologists with AI or looking at domestic workforce? And then the issue of the fairness of recruitment was mentioned. That's particularly sensitive in the health sector. We have now this morning talked about at the table of Europe-Africa relations on coherence issues and the issue of investment with Global Gateway, for example. So my question here is, how can we ensure that we don't, on the one hand, promise to our partners that we invest in local workforce? At the same time, we have bilateral agreements of EU member states recruiting actually health workers. So what's the role of the EU in ensuring that it is a fair partnership and it is coherent?
Thank you. So we have just over 10 minutes left. I would like less questions from the floor and more recommendations, please. So more hands. Okay, just over here.
Yes, sort of building on a lot of what's been said before, I think it's really important that, how do we better integrate, to integrate health in all policies and equity in all policies? Is there a way to tie those things together? COVID certainly demonstrated that. And another recommendation, I think, and that's where technology can come in, but with this migration, health, how do we track health workers and their competencies when they move countries, and patients, whether it's refugees coming from somewhere else, how do we track the care or their conditions? So utilize health for that.
Okay, and then over here.
Okay, a little bit of question and also can be used as a suggestion. I'm Andrea from the Mission of Argentina before the European Union. And we were really glad when the strategy of the Commission concerning medicines came out, because it's the first time we see the framework for international cooperation in an instrument. So my question is, in Argentina, for instance, we have very good quality doctors, and healthcare people. So if it wouldn't be useful in thinking of a frame of cooperation with displacement, it can be even temporal, because we are on counter seasons. And that would also solve this problem of not depleting the medical care of another country. So if you can think of a system of mobility, keeping them as a roster, it will also help their qualification and their skills, and I think it will be a win-win.
Okay, now I'm going to break my own rule of engagement and go for more than a batch of 3. So there were a couple of more hands. Okay, we have Debating Europe over here. Sophie?
Thank you. So I'm Sophie. I'm a facilitator for Debating Europe, and so I've been listening to the voices of citizens on the main global challenges that are there today. So something that got raised up there is that we need to talk more about the psychosocial state of our societies, rather than just the economic well-being. Like COVID had an impact on the concentration levels of people when they had to do teleworking. Heat waves have an impact on the efficiency of the people. So they find it important that there is also invested on the well-being on the work floor, because at the end this will also have an impact on the productivity and the economy.
Great. Okay, a couple more hands I saw. So this gentleman over here. Just behind here. Yes, this gentleman here.
Thank you. Jan Lekam, Chief Executive of Rare Disease Europe, EURDIS, and also founder of the International Rare Disease International. So it's not about to talk about rare diseases in that context, but really to call in terms of proposal for the next mandate of the Commission to really work on the European Health Union. We're really discouraged to see that after the COVID, it seems that it's too much back to business as usual. And while in fact within the current treaty and with political will, we can do much more on health. We need a bigger budget within the European Union for the agencies, and we need a stronger directorate of health than what we have today, which is absolutely understaffed to do the thing. We need also a long-term view. We need much more foresight on health. Everything is decided looking at 3 years, 5 years. That's nonsense. We need to look at 10 years, 20 years to create the change we want to see. We can tackle much more topics which have a high community added value of working together, still sticking to things without reinventing the wheel, to the SDGs, universal health coverage, clear objectives that we can achieve. So that's what really we would call for.
Great. Couple more hands. Recommendations rather than questions, please. There were a few other hands there. Where did we okay, there's here. Yes.
My name is Petrica Dulghero. I work with the Roma communities in Eastern Europe and the Balkans. And my challenge on the field is that I believe we're speaking about a Europe with 2 speeds when it comes to this. They're very rich and smart people, and then we have a lot of people who feel betrayed and left behind. And when it comes to migrants or when it comes to vulnerable communities, in the past, people have really benefited from data collection. Like the Roma community have been, data collected and then they've been sent to the Holocaust. So I think when we're talking about the social contract, I think we have failed so many people in Europe and so many people who are really not convinced that we represent them. And I think it's going to be very difficult to convince these people to give their data. So I don't really have
Do you have a recommendation?
I don't. I think that the whole point is to really bring them into this sort of forum, into these sort of conversations. And I believe it's really, really difficult because they don't live necessarily in Brussels. Nobody actually wants to go into a slum house or a ghetto. Nobody actually goes there to listen to them. And I really think it's important to bring them in, because otherwise terrorism is going to be, slowly coming from those.
Okay, so more inclusive conversations. Last show of hands, because we're down to the last minutes before we go back to the panel for closing remarks. Any more hands? No more recommendations? Not even questions? Okay, back to the panel. For the last, we have 6 minutes. So all 4 of you have about a minute and a half to respond to whatever you heard in the room and make some final comments. But I also have one closing question of my own to you all, and that is, what is your one ask for the next EU mandate in terms of this? Your one demand, yes, for the next EU mandate. Lubna, let's start with you.
Get to member states to really now collaborate for this. We cannot always have the same. It's the member states' dilemma, because healthcare and in COVID, we had to work together. And we have to cross that bridge now and open up these sandboxes. We've been talking about it since my time in the high-level expert group on AI, that we need AI sandboxes in multi-member states, not just one. So, and having the initiative for European Health Data Space, that could be a good bridge, but finally get us there. I think that's one of the key. If we get that, that will be really great.
What about a response to the gentleman who raised that question of the inclusivity of it and populations that may be wary of giving their data?
I think that will be really great. I mean, engaging the public to donate their data. We know that is as entrepreneurs, that's what we do. Go into the consumer directly and asking for data. I think if we have a multi-approach here, both top-down from, let's as member states agree, we have the European data space, we have, let's open up some hospitals as sandbox environments for these algorithms, but then bottom up, and I would say at phase 2, because you need to start collecting the data and making, at the end, the only unified healthcare app, AI app that can work is the one that is from the people. People are willing, are sharing their data and taking the benefits. If you want to opt out, then you're not part of it. If you want to share your data, you opt in, then you get the benefits of the automation.
Andrea, over to you.
Very briefly, I'll take a comment from a lady, and apologies if I'm wrong on that. No, the story of health in any policy is 15 years that I had that, it didn't work. So time to change. Next mandate, a policy for health, fully integrated, they're really omni-comprehensive, they use innovation as an enabler for change and transformation.
Great. Okay, Frank, back to you.
Yeah, my objective is that European Health Union, in a fully fledged and complete sense, is again one of the top issues in the Commission's strategic agenda for the next 5 years. That's what I'm working towards. Secondly, addressing the issue of equity, I would also like to develop a strong link between the European Health Union, on the one hand, and some of the principles enshrined into the European Pillar of Social Rights, notably principle number 16, which is about equal access to quality and affordable care and health care. And if we can bring that together, we can, let's say, define a challenge at EU level which combines the health union idea with issues of equity and fairness. Then finally, on data, I have a more radical view than Lubna. No, I really have a more radical view. I think the default position is that data are public. That's the default position. I created a Belgian health data agency to facilitate the secondary use of data, also for private actors. Parliament was nervous about that, but I forced it through. I created that health data agency, and we are really working on this. And indeed, the default position is that you share your data. Default position is that medical doctors stop their conservative fights against sharing of data with other people in the profession. And that's the fight we have to organize. Also at EU level, I do think that European health data space regulation is an important step forward. I think we should agree on it. I hope that will be settled relatively soon. Otherwise, it's business for us in the next 6 months. But it is a public issue. And I think that finally, because I did not answer the lady in green's question on the patient, sharing health data is fundamentally also about empowerment of patients.
Right.
And we should explain it also in that way.
Great. And the last word, Nicolas, to the Commission.
Now, well, just one remark on the care economy. I think we should be aware, and this is happening, of the importance of the care economy as a part of our economy. But this is an economy that cannot function like any other sectors. It's not like the automotive or, I do not know, a sector. It's a very special. So we have to also rediscover a bit the special rules, the values of interest, the public interest services, and promote that and take into account that. The gender issue is fundamental. This, if we do not really tackle the issue of working conditions in the care sector, because 80% of those working there are women, we should not talk about gender equality. So I think this is something we really have to continue. By the way, we have a recommendation on care and long-term care, which takes in all these aspects of quality, but also of working conditions, and especially also the gender issue. Now, I would say, with Frank finally, that for the next Commission, health union is important, but this will only work also if we have a different look at care and healthcare. So in our budgetary policies, this has to be integrated. And that's what we discussed yesterday about social investment. My last remark is about finance. Yes, I agree, we have to reform, but this means also there are in the healthcare sector enormous economic rents. Enormous economic rents. And this has to be tackled because this makes the financing of our health system more and more difficult. We have also to attack these economic rents.
Great. Well, thank you, all four of you. Thank all of you in the room for a really interesting discussion. Thank you for sharing your insights and perspectives. Before you all go to lunch, just an announcement about the next sessions this afternoon. Here in the TheMerode Salon, there will be a session on climate and industry and the Green Deal. In the conservatory downstairs, where you attended the plenary this morning, there is a session on a Europe of security and values. So enjoy your lunch, and we'll see you later this afternoon.
As you know, we have 3 panelists up here for later that we give a short pitch, but it's very much up to you also to dive into the recommendations and the solutions. But before we get to that, first we will hear an idea sharing, and we will hear that from Bella Lack, a youth environmental activist. But I have been talking to Bella, and she does not necessarily want to be called an activist. She thinks that has some strange connotations, but a very dedicated, engaged citizen who started working with biodiversity and climate issues, environmental issues, at the age of 12, I've understood. When she was 17, she gave out the book Children of the Anthropocene. She's now 20, studying in Edinburgh. And Bella, we are keen to listen to your pitch here and the next 15 minutes. I know that in your daily life, you're educating your own generation. Now you have 15 minutes to educate this audience. So welcome.
That is the song of the kawaii bird, the last male of the species calling for a partner who'll never come. That is what extinction sounds like. It also sounds like the revving of a chainsaw, the thump of a harpoon, and the whistling of a bullet. Extinction looks like miles of raised rainforest and oceans with more plastic than fish. It smells like car diesel and pollution. It feels like hopelessness, like the end of beauty and wonder. And sometimes it feels like my generation will be the ones inheriting when plastic and pollution and power have gained supremacy over all else. We so rarely take a step back and really understand and feel the loss behind the statistics. I will be pragmatic and I will discuss policy proposals, I promise, but first, please all close your eyes and picture the world 4.4 degrees hotter than pre-industrial levels by the end of this century. That was one of the IPCC's 6th assessment report predictions for scenarios with unabated emissions rise. But unless you've pored over climate models and understand the intricacy of tipping points to a T, it's unlikely that you can visualize the outcome and truly imagine the severity of what's to come. Keep your eyes closed for just a little bit longer. In 2020, I spoke to Belinda Rickamani, a young woman living on the Solomon Islands, who, from her window, has a view of an island called Wolondi Island. Wolondi Island is a window in itself, a window into a likely future. It used to be home to 1,200 inhabitants, and when I spoke to Belinda, because of rising sea levels and submersion, is now home to only one man called Timothy. He spends the day adding rocks to the wall around his house, trying to hold off the water for just a little bit longer. The reason he won't move, and I quote his words, "If I move to the mainland, I can't see through the trees. I won't even see the water. I want to have this spot where I can look around me, because I'm part of this place and it's part of me." And that, I think, embodies the stark tragedy of what we're all facing. The Solomon Islands have some of the lowest carbon emissions and yet face some of the greatest impacts of the climate crisis. Timothy is having to make the choice between staying in his house on a drowning island or leaving everything he's ever known and starting a new life somewhere else because of sea level rise, which he's played almost no part in causing. In 2017, I did my first public speech about the climate crisis, and I quote the exact words. I said, "In 30 years' time, if we haven't acted on the issue, we will look back to today and wish that we took action before it was too late," and how wrong I was. It wasn't 30 years, it was 3, before things became so uncontrollable and so terrifyingly immediate and glaringly obvious. I was warning of a distant threat, something that's coming, and that we must stop before it's too late. But droughts are already baking the land. Floods, I'm sorry, I'm just going to have to blow my nose quickly. I'm not crying, I just have a cold. Floods are already ravaging homes and lives. Hurricanes are already decimating cities, towns, and villages, and wildfires are burning uncontrollably. And if we continue on the course we're on, it will give us a good indication of what will happen if we don't dramatically slash greenhouse gas emissions. In other words, the normal of the Solomon Islands, where Timothy lives, is very quickly becoming the normal for the whole world. But all of you know this, I know that, and that was a bleak introduction. Despite all of that, I am actually very hopeful right now. And it's not a blind kind of optimism, because we're going to have to work hard, very, very hard. I see all of us a bit like a bunch of desperate hunter-gatherers. But instead of hunting for berries, we're hunting for fragments of a different future and trying desperately to communicate them to generate engagement and action from everyone. I try to use stories and speak to my generation, whilst trying to not sound scolding to older generations or they'll dismiss me, but stay hopeful because fear generates apathy, but stay somber because we're in a crisis, but remain joyful because no one listens to a doom-mongerer. Research and communicate and talk and act and advocate. And it has been a privilege, truly, to be invited to conferences like this where I'm surrounded by people like all of you, where I sit in the audience, literally overawed with the sheer power and hope in what all of you say. That wasn't targeted. I will proliferate this speech with metaphors and speak to this audience in the same way I'd speak to a school, because currently, quite honestly, I think that the qualities inherent to kids are the qualities that so many of us lack. It's the passion, the clarity, the curiosity, and the imagination that we need. And why are young people one of the biggest untapped resources? Because there's so much distrust in my generation. And why are young people distrustful? Because political parties aren't deliberating about what the world needs, they're deliberating about how to win. When I speak to other young people about politics, the conversation isn't geared towards opportunity and vision and how we could integrate into and create a new political reality. It's about the sheer horror of our current political reality and how best to protect ourselves from its consequences. We need co-collaboration, imagination, deep and genuine integration with a diversity of new ideas. In a world where we're taught to hyper-focus on the plastic coffee cup that you should avoid at all costs, and are scolded for the flight you take over Christmas to see your family, and we must turn our lights off one evening a year for Earth Day, it's encouraged and rational to stay willfully ignorant of the bigger picture. But when ignorance and this hyper-atomization and individualization and self-obsession is encouraged, who's doing the thinking? Who thinks for the greater good? Supposedly those in power. And currently, that's not for the greater or for the good. In 2021, I was very fortunate to accompany a team of young conservationists and scientists from Reserva Youth Land Trust into the Choco Cloud Rainforest on a conservation and scientific expedition to find and describe new species. We had been trekking through the reserve and spent 2 years fundraising for and working to protect that area. On one of his solitary escapades, Marco, a fellow member of the Youth Council and an Ecuadorian local, who knew his way around the jungle with his eyes closed, returned. When he returned, we were all gathered around the makeshift camp, and he gathered us around and opened his palm. The shard of yellow rock he held in his hand was a mix of gold and pyrite. Marco had found illegal mining very close to our camp, where over 3 kilometers of an ecologically critical gorge was located. By the looks of it, the miners' tracks were fresh, and they were still in the area. The next morning, some of our team was to go and confront them, unsure of what they would find when they arrived at the camp. But what we discovered, speaking to the community the next morning, is that they didn't want to be mining at all. Mining companies had come into the area with a very promising tale. It was a story of wealth and a better future, and they had employed the local people under this pretense. They'd used a story. They'd used the most basic narrative plot, which turns out to be tremendously powerful. George Monbiot, a British investigative journalist, calls it the restoration story. It goes as follows. Disorder afflicts the land, caused by powerful and nefarious forces, working against the interests of humanity. But there's a hero who will revolt against the disorder, and he'll restore harmony to the land. The mining companies promise to overthrow poverty inflicted by poor governance. Fossil fuel companies promise fairy tales of green growth, depicting themselves as both the anti-hero and the hero. It's in the Bible, it's in Harry Potter, it's the Lord of the Rings story. And without a narrative structure, we as humans crumble. We fall into a failure of imagination, and then subsequently we fall into apathy. This conference must help to rewrite the framework of our story. And when we all leave the conference, we go back to our separate houses, countries, and cities with concrete policy proposals and plans to act in our own lives. We must create and piece the narrative together until a new story replaces the old. I want to ask each of you 3 questions to keep in the back of your mind as you debate and deliberate throughout the next session. Firstly, how do you define success? This is another metaphor, by the way. I love my metaphors. We're in a hurtling car. The car is society. And right now, we judge the success of our car by a singular measure, which is how fast it's going. We don't mind if there's a wall right ahead and we're hurtling into it. We just want that car to go a little bit faster. But why don't we redefine the success of our car? What if we actually define the success of it by the contentment of the riders? Whether they'd had a good journey in good company, had access to educational and entertaining content during their ride. What if we dared to imagine a new way of living where degrowth doesn't terrify us and we define success by connection and well-being and happiness? Secondly, do you allow yourselves to be uncomfortable and to be ignorant? It's hard not to use our freedom to just consult with like-minded people in an echo chamber. I used to feel like I'd achieved something when I'd post a horrible photo castigating a trophy hunter on Twitter, and my echo chamber of Twitter followers would agree, and we'd sit there typing away furiously on Twitter, agreeing with each other, and then we'd tuck our phones away and think, another great job done. Maybe we should be feeling like we're going against the tide. Engaging in debate and meeting others where they stand means you're facing resistance, and resistance means ideas are reaching people who need to hear them. Lastly, are you trying to just close the book, or are you trying to open a new one? All of you are leaders in your own right, meaning you are looked to for guidance as people create their own narratives. And like those seabirds in Australia who steal materials and make their own nests, people will take fragments of how all of you live and make that part of their own identities. Humans always have and always will do this. It's therefore our responsibility, your responsibility, to value nature in cities, to value educational systems that champion, not counter diversity, to uphold solutions rather than blindly following a preordained path, to research meticulously who you support, because whilst I would love to believe that we're all inherently good, there are undoubtedly people out there who will follow profit over all else. And I want to be clear before I finish, this conference is the fun. It's the visionary talking shop, which we need desperately, yes, but it's not the work. The work begins when we all leave and we put these ideas into practice. And I want to leave you with my favorite quote of all time, which is by a researcher and scientist called Mary Hegler, and she says, "We can be overwhelmed by the complexity of the problems, or we can fall in love with the creativity and the possibility of the solutions." Thank you.
Bella Lack, thank you so much. I think you could hear that, you could feel that people were really with you there. And 3 difficult questions to end with, I think. How do you define success? Do you allow yourself to be ignorant, or are you actually doing something, and are you trying to value nature in the way you live, in the way that we live, and in what we support, what we do? Thanks a lot, and I must say that although we could hear that you are concerned and you are actively engaged in this, it was also good to hear that you still remain hopeful. So thanks a lot, Bella Lack. That set us off. Now we are diving into some of the specifics when it comes to this question about how we can align our climate ambition and still create the jobs, the industries we need in Europe. What we are zooming in at is, of course, again, also in this session, the 10 policy choices. They are available on the virtually if you do not have them in front of you. But the aim here is to try to identify what should be the key asks in this field for the next EU mandate. And the most relevant recommendations to zoom in on in this session, that will be number 2, accelerate carbon reduction for public good, and number 4, create the conditions for inclusive and sustainable growth. We can say that we have the direction, we have the target set. We also have a pricing system, at least to a certain degree. Some areas still missing, for instance, agriculture. But and we also have some regulation in place. But we are also challenged in EU, standing between, for instance, an international Inflation Reduction Act in the US and the state budget of China on the other hand, so we are being squeezed. How do we sort of cope with that? And maybe how can we speed up the way we are innovating and developing new technologies and practices in Europe? We have 3 discussants to set us off for that discussion. And they will have 4 to 5 minutes each. And I just say I'm not a very polite person. I'm from Denmark. We are not very polite. So please respect the 4 to 5 minutes, because I also really want this crowd of people who have a lot to contribute to have some time. We will hear from, in a moment, from Franziska Brandner, a German politician who currently serves as a parliamentary state secretary for economic affairs and climate action. And she is also the ministry's special coordinator for the Extractive Industries Transparency Initiative. And prior to this, Brandner was a member of the Bundestag and a member also of the European Parliament. Following her, we will hear from Ricardo Mourinho Felix, who is vice president of the European Investment Bank, also called the EU Climate Bank. And in the EIB's management committee, Mr. Felix is responsible for oceans, sustainable finance, the MFF, and also in support for climate and Invest EU. So we're looking forward also to hear from you. And finally, we will hear from Stintje van Veldhoven, Global Vice President and Regional Director for Europe at the World Resource Institute. And Stintje is currently based in the Europe Regional Office in The Hague. And also she has been a prominent politician in the Netherlands, most recently serving as a member of the cabinet responsible for public transport and environment, and as the Minister for the Environment and Housing. And actually she also has a background in the parliament in the Netherlands and as an international diplomat. So please, if our 3 panelists will come up here, and then Franziska, if you would start us off. And I know that the topic that you will zoom in on, just I guess as an example of some of the challenges we're working with here, that is on hydrogen. And that is just one example of sort of everybody is talking about hydrogen, but how can we actually make it fast enough and get to the scale when also competitors are working in this field? You have the next 4 to 5 minutes, please.
Thank you. And I have, met luckily many very polite Danish people. So, as you were saying, Danish are not polite. Look, before I go to the hydrogen, I think the challenge is large. It's not just a green transformation. It's also that we have to become more resilient as Europeans, and we have to do both of them by staying democratic. And I think that makes the challenge even a bit bigger, because I'm not ready to lose our democracy over the transformation. And that's, I think, a real challenge we have to face. And at the same time, we have to become more resilient and less vulnerable as European Union in that process. So, it's an even larger challenge. And I agree that we need technologies for that, resources, and part of that is then the hydrogen. And luckily, this sector is moving fast, but with still a lot of question marks on how we get there. So the question, and you just, Connie, were starting to raise these points, is how do you advance in the transformation? Usually you always have the pricing, you have the regulation, and then you have financial incentives. It's usually the 3 that you mentioned. They all have their pitfalls and have their advantages. Price, the question is who can afford? And then the rich could always afford pollution and others cannot. It is especially significant when you talk about the dimension of maintaining democracy, because in the end, in the theory, it might work all perfectly with the pricing incentives, but in reality, it hits people and they usually behave differently. Second part, regulation. Two challenges. You need to have it technically feasible and to be possible to do it everywhere. And also there, it needs to be affordable for everybody. That's the same. Then you need to make sure that if you set standards, that also the poor population can afford it. And if you lose out on this side, that the poorer can afford it, you also have a problem on the democratic side. And on incentives, financial ones, this is what the US is doing, Inflation Reduction Act. It's wonderful. Two downsides, you need big and deep pockets, and you're not sure you will reach the goal, because maybe people will not do it. So we're trying to do a mix of all of this in Europe. I think we have not decided to go just one down direction, just money, just regulation, or just pricing. And I think that what makes the EU more complicated, and why some of the companies say, oh, why can't we have it the easy way, just financing, just pricing. And I'm in a lot of debates when people say, oh, why do you not just do the pricing? Why do you not just do the financial incentives? Because it's complex. And because the EU is not just full of rich member states that can afford to do everything. And I think part of the challenge is to find a good balance and the interlinkages between the three approaches we have chosen in the EU. So we have now the regulation, part of it on for hydrogen. We have a delegated act on what is green hydrogen, etc., where I think we can go. The pricing question is still difficult because it's not yet an existing market, so we need to take out risk in that pricing market. That's what we're doing with H2 Global as Germany already, where we guarantee the offtake a price for 10 years, so which gives security on the pricing. We are doing this now with the European Commission to make that into a European Hydrogen Bank, which I think would be actually perfect. And then, of course, financial incentives. There we support the local networks, production, capacity of electrolyzers, so many dimensions where we go in and chip and support financing of new technologies. And the large part and the most expensive one will be infrastructure. So the question is, how do we finance infrastructure, and how do we do this as Europeans? It's a critical European infrastructure. And of course, the question is who will pay for it and how many generations will pay for it. Because if we make that infrastructure to be paid by one generation, again, we hit the democracy wall. So the question is, how can we spread that financing over, let's say, a couple of generations, just as we have done in the past with the railway. It wasn't financed by one generation. And then last point, very quickly, how do we make this not just a European project or a German, but an international one? I think we have to really diversify our partnerships. That's where resilience comes in, that we have a priority for European production, at-home production, but when we go abroad, we diversify. We never, ever become dependent again on one or two suppliers, and that we build up green supply chains with partners. And this building up along the supply chains is an opportunity to also create new partnerships worldwide on a new basis, and therefore the EIB also needs to become very much more internationally and go into countries which might be risky and might risk it AAA of the EIB, but might be very important partners on this trip. So this is where I think these are the 4 points I wanted to make. Thank you.
And thereby you almost handed the microphone to Ricardo Moreno Felix, because the question is, how does the EIB work with these things and incorporate climate in whatever you do? And it's difficult times economically and inflation and many things, but nonetheless, how are you sort of living up to what we just heard from Francesca Brandner, both in mitigation and adaptation?
Thank you very much, Connie, and thank you very much, Francesca, for setting the stage and all the key questions that you have. And I fully agree that it's an enormous challenge, and we need to face this challenge, do the transition while preserving democracy. In my view, the only way to preserve democracy is to do this transition together. if we don't do this transition, if we think that we can continue in the same unsustainable way of living, we'll face democratic challenges years down the road. So better we define a common way where we have the appropriate mechanisms. And the appropriate mechanisms mean all the three ingredients that you just put forward. The incentives, the correct pricing, and the mechanisms that finance this transition. To finance this transition, so this transition will be maybe the largest wealth transfer that we'll see at a global scale. Some people will be the winners, some companies will be the winners, some will be the losers if nothing is done. The only way to make this work is to think about and to create the appropriate market mechanisms such that we envisage transfers that allow that there will not be all winning winners and ever losing losers. And that's the challenge that we face. Inside Europe, in good time, we decided to put in place the Just Transition mechanism. And this allowed to create precisely the mechanisms that allow, for instance, at EIB that is involved in implementation, to finance reskilling, to finance transformation of areas where we have lignite mines, where we can move from fossil fuel-based regions, for which the wealth was created based on fossil fuels, to regions that reinvent themselves and that create new areas of sustainable business that allow people to maintain their livelihoods and to originate wealth from sustainable sources. A key challenge that we face is that in Europe, you have just 10% of global greenhouse gas emissions. So 90% comes from outside Europe. I can tell you that 5% comes from Latin America and the Caribbean, but guess where the remaining 85% come from? And we need to face this challenge in a global manner. So we need to work together. Europe, the other, the European Investment Bank, other multilateral development institutions, the World Resources Institute, we need to find an international agreement, an international consensus on how to do this journey together and how to ensure that resources flow where they are most needed. EIB is already operating outside you. So 10% of we do of our funding every year is outside you in quite challenging areas of the globe, and precisely to support the transition in other areas. That's precisely what we are doing with the European Commission when it comes to Global Gateway. Global Gateway is precisely that, a program, a mechanism, an instrument for European institutions to operate outside you under the principles of democracy, rule of law, and supporting a just transition in other parts of the globe. Can we do this in isolation, keeping the AAA of EIB? No, we need to have appropriate risk sharing such that we can operate in regions where usually a AAA institution does not operate. And that's precisely how we work together with other development financial institutions in Europe, with KfW, IFT, BGK, others, and also in close cooperation and under the mandates of the European Commission that allow us to do this blending and to extend financing in areas of the globe where the risk is high, but with the support of the Commission, we can do this blending and finance projects of green power, of adaptation, of mitigation, inside and outside you. To conclude, because time is running, and on adaptation that was raised by Connie, I think adaptation is a big challenge. So with the crisis that we have, energy, geopolitical tensions, we have quite substantial front-loading of investment for mitigation. When it comes to adaptation, it's much harder. It's much harder because the effects of not investing in adaptation are catastrophic effects that show up in the future. And when you do the investment in adaptation, in fact, from a democratic perspective, it's hard to explain to the taxpayers where you are spending money just to build what they have, because they just realize that it's not resilient when it falls apart. That's a big challenge that we have. I think we need to create the appropriate mechanisms, to have the appropriate financing mechanisms, and of course to ensure, as you said, intergeneration fairness of the investment. We need to invest. These investments will take a long time. That's why EIB finances these projects with tenures that go up to 30 years, because this is an immense amount of funds, not only public money will never be enough, but also to bring in and to crowd in private funds such that for each euro that the EIB invests, we can bring 4 or 5 additional euros and multiply this investment by 5 or more, bringing private partners that will go through this journey and that share the risk with us. And that's a critical part, how from the public resources, EU budget, EIB capital, we can make a much larger investment by crowding in the private sector. I'll stop here for interest of time.
Thank you very much. Stintje van Veldhoven. In this mandate also, a lot has been said about circular economy. We must go electric and really electrify wherever. But when we think about the clean electric future, we know that our economy will run on an abundance of raw materials, critical raw materials that we do not have in Europe necessarily, lithium, copper, and cobalt. How can we ensure that we embed a circular approach to these critical raw materials, as you see it?
Yeah, thank you very much. And let me dedicate 1 minute of my 5 minutes to react to Bella. I had the pleasure of sitting next to you at dinner yesterday evening, and you already impressed me then, and even more today, so keep doing what you do. I would say your message is also to us is very much time is up, right? So it's literally to all of us sitting here in this room to make that difference. We can no longer defer to leaders after us, because there's one thing that these leaders will not have the power to do, and that is to turn back time. So thank you for underlining that. And for me, success is both the quality of the journey and the destination. And let's all keep that in mind. We're heading towards the worst destination, which is that brick wall. And indeed, this brick wall also is composed of a lack of critical minerals, which we will need for our transport and energy transition. There is no 1.5 pathway without transport and energy vastly decarbonizing. But we also live on a finite planet, which means that there is no infinite amount of those resources, which means that for the world to triple its renewable energy capacity by 2030, we need to be able to secure, and this is only for the energy side, the resources to set about 1 million windmills. That is about how much we will need. We will face demand up to 6 times which you currently have of critical raw materials such as lithium, cobalt, and others. So to make sure that we stay within planetary boundaries, the circular economy is often cited as a solution. But many people actually take a very narrow view of that. They feel that circular economy is all about recycling. No, it's not. It's much broader than that. It is also very much about more efficient demand for resources and reuse as much as we can. It's about needing to take away barriers, and it is about needing to source as sustainably as possible. So about the barriers that are currently holding us back. First of all, the cost of transport, which can amount now to up to 40 to 60%. So we need much more efficient mechanisms and infrastructure like collection systems to be able to cut those costs. We also could very much use incentives. Here again, it's regulatory, but it's also incentives to make sure that it becomes uneconomical not to recycle. Europe has great experience in setting the right regulatory mechanism that actually can make something uneconomical, like the extended producer responsibility or supply chain directives. We could use that much more. We also require a huge change in how we actually design things. If we design solar panels that can never be recycled, we're up to billions of tons of waste that actually contain all the materials that we use. Europe has no resources, hardly any resources underground. We do have a lot of resources above the ground, but we're just using those very, very poorly. One of the things that we're doing is shipping these materials back to Africa under the presumption of secondary use. We're just dumping our waste. Europe should actually really be cleaning up its own mess by making sure that we recycle those materials and not shipping them back to Africa under the presumption that they will be used, the materials or the mechanisms and the machines will be used again there. And then there's something pretty uncomfortable. Bella also talks about it. We need to dare to get uncomfortable. And the demand side is the uncomfortable elephant in the room. And as a former politician, I know how difficult it is to talk about demand side measures. We have to. If we continue to drive ever bigger cars that need ever bigger batteries to bring them further, we will never be able to meet that race for those materials, or we will take an unfair share of what is available to the world. Europe is not the only region in the world that needs to go through this transition. Europe has been successful in the past. Look at the average size of a European car compared to an American one. We can do that again, and we must. We could even look further at reducing the very need for cars. And of course, in rural areas, that's much more difficult than in urban areas. But people are moving to towns, and in those towns, we have the opportunity to design our cities differently, to design a use of a car out of our daily life. And if every family has one car instead of 2, 3, or 5, that will radically reduce the demand that we have for these critical materials. Next to, of course, very many other benefits to not using your car in the city. Yes. In short, we need to make sure that we design the system, that we look at the system behind the demand. Then finally, on the supply side, because even if we design better, if we recycle better, and if we design our demand differently, we will still need new materials because these sectors are vastly growing. So when we mine, we need to mine responsibly, and we have to make sure that this is not a new colonial area of extraction from those countries that have these resources. We need to make sure that this provides them with development as much as us. So we need to look at Africa in a very different way. The Africa Climate Summit positioned Africa as a continent of solutions. And I think Europe has every geopolitical reason to take them up on the offer. If we don't, the Chinese do, and we are losing the geopolitical momentum as much as we will be losing the technology race. So these are the things that we definitely need to do, and I think this very much aligns also with some of the points that my two speakers before me mentioned. Thank you.
Very much so. Thank you very much. Thank you very much also for bringing efficiency and the demand side into it, because now we are going to discuss and have input from you also relating to the recommendations, among these 10 policy recommendations. And there, as you saw, when it comes to the topic that we are discussing in this session, efficiency was very much mentioned, and that we could gain a lot in Europe by focusing more on that. And it was also mentioned that our classic economic tools may need to be somewhat adjusted. And for instance, it was also mentioned that we must have changed taxation, and that speaks into this behavioral and demand side taxation also. So there should be a lot for you to comment on. Please raise your hand, please say who you are, and please try to be, you don't necessarily have to ask questions to the panel. If you have sort of some point of view that could be interesting for Friends of Europe to carry on in the continued work with these recommendations, please don't hesitate. And the first one who had her finger up is Sandrine Dixon de Cleve, who is also co-chair of the Club of Rome. So, Sandrine, what is your main message?
Thank you so much, Connie, and thank you to the panelists. Maybe building on some of the great insights that we saw, the time's up element means that we need to think differently. We've gotten into this mess exactly for some of the reasons that you've indicated, that we've actually not been putting in place systems approaches, and we've been focusing far too much on consumption and growth rather than on the way in which we live within our finite boundaries. So I have three key thoughts. One is systems approaches for joined up thinking and acting. That means that we not only, as you very clearly said, Connie, in your original hearings when you were becoming commissioner, that we needed a mainstream climate, but that now we have to actually mainstream the complexity of the polycrisis. And we have to think through the way in which we can link up our institutions, whether it be the EIB and the capital flows, alongside the European Commission, research and innovation, Horizon funding, cities, missions, etc., but also the way we also link up our policy. Some of the issues that we've seen is, for example, the fact that a lot of our climate legislation is not linked up with our circularity legislation or our materials and our DG GROW policy proposals. And we're starting to see those links, but we don't see enough of them. We also see that, for example, we're still stuck in Industry 3.0 rather than Industry 5.0. And actually, we've been proposing Industry 5.0 in the work that we're doing at DG Research and Innovation. The next key one is simplification, optimization, and communication for ambition. And that's important because that is both not simplifying to decrease our ambition, but simplify to optimize our ambition. And that means that we need to get much smarter in terms of the way in which we look at the waste and the perversities in the existing market, whether it be subsidies that are going to the wrong things, the way in which we price our externalities. And then the third is innovating for success and prioritizing. DG Research and Innovation, which I've been actually supporting in terms of a chair of their new expert group on the societal impacts of research and innovation, is looking at people, planet, and prosperity. And they've put that as the core of the way in which they put forward new funding. So that means that we need to look at the way our universities are working actually with our industries in creating triangles of research and innovation, the way in which we look at education, and the way in which we think through the complexity of the teaching that we need to have the future leaders that have to think through also what their role will be. And so I'll end with this. The simplification also of the current system that we have that was purely bureaucratic in terms of the way in which we enable industry. Simplification of the permitting, simplification of being able to come first in terms of infrastructure development, whether it be charging stations or whether it be investment in new electrification and other possibilities.
Thank you very much, Sandrine. You can hand the microphone to Nick, maybe just behind you. But just one thing. I know that in this room we also have Julie Melez and Sophie Nevin, who have been facilitators of the citizen focus groups. And I'll just say that if you want the floor, please, it would be really interesting also to hear from sort of the citizens' deliberative initiatives that you have had. But Nick, maybe first.
Great, thanks very much, and thanks for some really interesting remarks. This comes back to the theme of the social contract. I've been to lots of meetings recently full of CEOs and ministers and people talking about how they're going to invest a lot of public money to maintain resilience and find critical materials, actually much less invest in circularity and do demand side. And my thought there was, what's the social contract with the public on how we spend their money on these issues? Because actually, we are making bets. Because we don't know how much hydrogen we're going to use versus how much electricity versus how much CRM, because the technology is in such flux, and that's good. But we actually have to invest in options. We haven't got the choice of picking one winner. And that requires legitimate choices. How are these choices going to be legitimate? How will the public see those choices clearly and not think they're made by corporates in rooms, which I sit in sometimes? And thirdly, how do we, because the point of that is to make sure this is bipartisan support. If you see the Republicans' attack on IRA, we do not want that. We do not want this politicized because we need this to work, and we know we're going to make mistakes. That's not a problem. But we need to make legitimate mistakes. I'd just love to have all of your views on that. And Ricardo, an extra one, if you had Chatham House rule, I assume we're Chatham House rule, aren't we? Or you can be Chatham House rule. If you had your magic wand and could do in Europe what we've been doing in the global MDB system, have a roadmap for evolving the whole ecosystem of European national banks, the EIB, to support this, what would be some of the things you would want to do so that we use the assets of the European public more effectively to deliver the transition for the European public more fairly and at the speed we need? Thank you.
Let's hear from Ricardo on that specific one, and then maybe our two policymakers or former policymakers could also comment on the first part.
Well, thank you very much for the question. It's an impossible question to answer, as you can imagine. But, well, we are working together in Europe, and we are working as a system or ecosystem of national promotional banks. And the EIB is playing a role working with the other big players and some small players in Europe. If you can bring all the public resources together, it will not be enough. So what I think we can be more efficient is in defining common instruments and a key issue that is aggregation. So aggregation is a key issue for any institution like EIB. And that's why we have this protocol and work with the World Resources Institute precisely to do aggregation. We can reach the big players easily, directly, but for reaching the small players, we need to go through what we call intermediated lending. We need to lend to somebody that then implements it locally with our policies. And that's the type of network that we need, and we do it with the national promotional institutions. Then we need, and that's, I'm speaking this all the time, but I'll repeat it again, I think we need an internal market in many dimensions, not only just the internal market that we speak about, but we need the capital markets union, we need the banking union, we need a proper risk-sharing mechanism in all the dimensions. We need scale, and to have scale, you cannot deal with a Europe where you have 27 insolvency regimes, for instance, because we'll never had pan-European VC capital funds that will bring technology to the level that you have in other parts of the world. And that's what happened, is that some companies leave to other parts of the world just because they can't find the capital in Europe. Some other companies do not grow enough and do not scale up enough. So I think this is a key pillar, this harmonization, this creation of a single market where you have similar rules and where we can scale up projects and deliver on big impacts. And that's how that applies to all areas, from mitigation to adaptation to innovation and to cohesion.
Franziska, to Nick, maybe his point that whether we like it or not, we cannot just pick this or that technology. We have to do a whole host of things. And sometimes there will be errors and mistakes and lost money, maybe also lost investments. How to secure the legitimacy, as it was mentioned, or you could also say how to avoid polarization among our citizens.
Yeah. Look, we have technological developments over the last 10 years, which few would have predicted, and we have some that are happening right now, which are again astonishing. So it's hard to say, how will the battery storage be so important that you actually don't need hydrogen? So there are many questions. We have been calculating many scenarios with lots of experts. So you try to make the best scenario, the most electricity impossible. So we try, of course, to calculate it, and then we go by no regret. So what can you invest in that you will, for sure, not regret having invested in? And I think you will have to make choices and be open for technological developments. And you will need, in any case, a lot of infrastructure. And we just know that it will not work just in regional context. We always said it's beautiful, we have a decentralized energy system, partially true, but certainly not entirely. Certainly not entirely true for Germany. So if you have that as a point, we try to create, it sounds a bit pathetic, but I think it's important, a new patriotism for infrastructure. And really to say we need this to be seen as a project of generations. We know that it's needed for digital, it's needed also for the green. We need massive infrastructure investments. And this will, you are talking about 10, 15, 30 years? Sorry, it's not in long. 50, 55 years. That's the dimensions we need to speak so that the current generations can finance and afford it. And I think if we don't take that perspective, we're not talking truth to our citizens in terms of the size and amount of challenges we have in terms of building that infrastructure. Because we cannot just focus on one. It would be really horrendously wrong, especially because we don't have time to test it out. If we had like 20 years, we would say, okay, let's see how the technology develops and we go for the best, but we don't have those 20 years to see. Okay, on the raw materials very quickly, because I think, you were saying we don't have so many of them at home. It's not true. In Germany, we have plenty of lithium. We have that in France. We have it in the Czech Republic. We have it in many countries.
It's not developed, yeah.
It's not developed. We have many of these resources at home, silicium, etc. So the question is, if I go to Chile and other countries, and then they look at me and like, oh, why are you not using your resources, by the way? And I cannot answer because it's beautiful where I come from. So I think we also need to have that honesty about using our own resources. And I'm sure that if I would have to tell my citizens, we only use the lithium that comes from your neighborhood, we would drive smaller cars. Because if we keep on externalizing the resources needs to other countries, we will never get to the demand side.
Stinja, a brief remarks on that also?
Yes, absolutely. For lithium, that may be the case. That's unfortunately not the case for all the resources, but I do very much agree with your point. And it also relates to my answer to your question, Nick. I think the first element is on the how is we need to make sure that everybody understands that it's not a question of if we're going to go through the transition, but that it's a question of all of us deciding how. And that means that if you don't like measure A, you'll have to come up with what measure B you're going to propose that does get us to where we need to be. I think that's an important part of legitimizing this entire process. And then the second point actually also relates to what Bella said. We need to also go to where the resistance is. Because people are not opposed because they want to destroy this world, because they feel like their interests are not being taken into account equitably in the overall solution. And if you combine that with the how, right, you make them responsible as well for finding that equitable solution, then you get to different outcomes. Because it all depends on what we find most important in this process. When I was negotiating the Dutch climate agreement, trying to align Dutch climate policies with Paris, we thought that the lowest price for CO2 would actually be what Dutch voters value most. In the transportation sector, that turned out to be completely wrong. People found the equity basically of the measures more important than a packet of measures with the lowest price. They did not want the lowest price if that meant that rich people would get subsidies. They preferred a package with a higher price if that meant that this became available to all. And that is what created the legitimacy for that package, which is still there. So I think it's very much a question of going to where the resistance is, but in the context of it's not a question if, it's only a question how, and if you have criticism, then you need to also take responsibility for providing an alternative measure.
Very interesting lesson from the Netherlands. And I must say this German thing, a new patriotism for infrastructure. I would take it that that's not an easy task, but interesting perspective. We're going down to you, and then afterwards I think, is it Julia who would, that we will hear from, but first here.
Hello, my name is Ivan Stefanko. I come from Slovakia and I'm MP in Slovakia. And I was listening to you and also to some comments. And I have a question actually. And why do you think or one commentary and then a question. According to my information, more than 50% of all the emissions coming from Europe are made by the heating. We are never discussing about heating, and is it true?
For a year in Germany.
Yeah, but I know, and that's why I'm saying that
gas
we have
boilers
to. And it's very important to speak about why the emissions from heatings are created, and that it is because you are burning coal and so on. So isn't it better to invest in, for example, geothermal energy and to create this infrastructure for 30 years and really to invest in a cleaner heating system? So that's my question.
I think we can make that short up here because I think that our panelists would all say that that would make sense. So you can come back to some details there, but let's hear from one of the facilitators from the Citizen Assembly also.
Thanks everyone. So I'm Julie Malaise. I work for Debating Europe and I'm moderating French focus groups with citizens. And I've been listening very closely to everything that was said. And I've heard the words citizens, democracy, and resistance. And I would like also to take the opportunity of having Bella Lek today here to say something about climate activists. This was something that was raised by Sonia, who is a French citizen. And she said that activists working on these issues right now are gradually being criminalized. And this has not only an impact on them, but on democracy as a whole. And on the way we protest and we express ourselves as citizens. So this was just a comment on, democracy as a whole and our rights to act. So thank you.
Thank you for that. Before we take it up to the panel again, we need the microphone over here to Sunny Kapoor.
Thank you. This was not the role I wanted to play. But somehow I find myself speaking on behalf of 6.5 billion people in the rest of the world. Now, some of you are familiar with the thinking I've developed, the EUI and the Indian G20 and the global grand bargain framework to reconcile growth with development. And two elements of that are absolutely central to this conversation. The first is all mines are filthy, right? Workers lose between 5 to 25 years of life. They're toxic. You can decide degrees of toxicity. You can choose between grand theft and corruption or just bribery. Mining is problematic, dirty, filthy, corrupt, okay? But there's a huge difference between the best and the worst, right? On corruption, on toxicity, on life expectancy, on clean technology. And we screwed up. We were part of that in the last resource curse for many of the lower middle income countries. our companies, our governments, played footsie and we screwed up, right? There's a fantastic new development opportunity for the countries that have the best reserves of many of the critical minerals in sub-Saharan Africa and Latin America, right? Let's make a plan, let's do this better. There's a gestation period of 10 years, and we know that no matter what, the Norwegian Prime Minister says or the German Parliamentary State Secretary, the reality is that the economics and the NIMBYism of mining for minerals in Norway or in Germany, even if they existed, is much, much more tricky, right? So let's do it better. And the answer to the China scare is not to have the whole downstream capacity built in Europe and the United States, but to have 7 or 8 wonderful downstream capacity building things built in regions. It's a fantastic opportunity. That's the mining compact. And the second, the technological compact. Clean tech has been mentioned several times. I sit on a number of these VC boards. And what is absolutely shocking for me, one is the very loose relation between how central a sector is in the macro significance of its emissions, for example, building, versus where the money is going, right? Which is mobility, which is sexy. That's number one. Number two, yes, we need much, much more investment in this, right? Number three, most of this is happening within the OECD or in China. And last but not the least, and I give you a concrete example, as in Sweden meeting the Ministry of Trade.
Has to be brief, Sonny.
Yeah, Trade and Industry and the green steel firm that everybody's talking about, right? And I asked, hey, what's the plan to deploy at scale in India? And they didn't. Most clean tech VC firms are focusing on the greenium, low volume, high margin selling into rich countries, when the fact is, over the next 30 years, India alone will use more steel and cement than North America, South America, and EU combined. Do we have a plan for a large-scale, immediate rollout of the latest, cleanest steel, cement technology in the places where the majority of the infrastructure is to be constructed? Otherwise, the numbers don't add up.
Very clear question. Francesca?
Yeah, very briefly, and then I'm sorry that I have to go back to Berlin. Bella, I thank you for the points you made. I think this democracy question is the key one. We're debating this with our actors because, of course, the activism has also changed, and I think we have to make sure it is, protected and at the same time really achieves the goal it tries to achieve. And I think that's a debate it's not an easy one, but we do it all the time at least in Germany. Second point about the heating, I totally much agree. We have to work on heating. We have gone a tough year on heating, and I can tell you regulation is part of it, but the most important is to make it affordable for everybody and to make sure that this is right from the beginning. And that costs you billions that you have then to invest, and it's really expensive. Geothermal also is what part of it. Wherever it works, you should use it. It is a very important part of the heating, but you have you have many sources that you can use, and you create new technologies. And I think that's, by the way, the heat pumps is a perfect European example. Lots of the heat pumps now sold in Germany are produced in other EU countries. And there we have a build-up of a green production line within the EU. That's actually quite interesting. On Sony, your point, look, the problem is often not with the resources. The problem is the refining, which is very dirty, and that is mainly happening today in China. So the question is, if we diversify, how can we create cleaner refining in partner countries like Brazil, China, Chile, or South Africa, or Indonesia? And that's a big investment question. The problem is it's always going to be more expensive than it's happening in China. And resilience and being green has a cost, and who is ready to pay for it? And how do we distribute it? And that is always the question. How do we distribute these costs? Who is paying for it? We don't get our companies to invest these days as much as they should because, it's just so much more expensive. So we're setting up state funds now to do this. But, in the end, the question is, can the state support everything? How deep are our pockets? And how do we then have to regulate it? So it's complicated on creating these partnerships because in the end, our companies need to invest in these countries and build it up. A smelter can be very clear. A copper smelter we have in the center of Hamburg. You don't notice you have a copper smelter. If you go to a copper smelter in Chile, you can't send your kids to school. And that's the difference you have in terms of technology. But that technology is so much more expensive. And then you need the EIB to finance it.
And then you leave. Thank you very much, Franziska Brandner, for joining us. I hope you will catch your plane. The rest of us, we still have 20 minutes left, and there are really many hands in the room. So if it's okay up here, I will take a few more from, I think you were first. Yes, please. The microphone should come up here.
Thank you very much. I'm Adel Gamal from the European Energy Research Alliance. And a question, I've basically two question comments. The first one relating to critical raw materials. And thank you very much for the excellent perspective that you provided on this. It's amazing how much we will need of these critical raw materials. I'm just wondering how we can combine the strategic autonomy, European strategic autonomy, with the fact that all the clean energy transition that we're planning in Europe is 100% dependent on the availability of these critical raw materials, which are almost 100% imported in Europe. And we know that producing them inside Europe, first of all, will require at least 15 to 20 years, and also will unveil a lot of problems in terms of competitiveness, because producing them in a cleaner way and with more ethical standards will be not competitive at all. So we're totally dependent on this. Just to mention, rare earths are used for wind turbines. We're importing 98% of those from China. PV panels, 95% of the cells are produced in China as well. Hydrolyzer, most of the critical minerals needed are also at least processed by China. So we're totally geopolitically dependent from China. And so this is my first comment and question. How do we combine this with strategic autonomy? The second element I would like just to highlight is the fact that we're talking about green industry. And by green industry, there is underlying the notion of growth and green growth. I think there is a major question that hasn't been addressed here, is the compatibility of economic growth as it is defined today with planetary boundaries and sustainability. And I wonder why we don't address the question of demand reduction, which is absolutely fundamental.
Yeah, thank you very much. Very specific questions, and I could see, Stintje, you were really writing down, and afterwards the microphone should down back in the room.
Yeah, so first of all, we've been asleep for far too long, which means that we will not have a solution overnight. But the things that we need to do is to start working on diversification, on reducing demand, on designing better, and on also using our trade mechanisms to ensure that when we import, we don't just import raw materials, we enable Africa to also develop their own industry, and that through the trade mechanisms that Europe has, supply chain mechanism that Europe has, we actually create a market for those well-produced products. But we have to then again make sure that we help the countries to actually comply with those regulations, because otherwise we're actually only enhancing their problems and our own. And then second, on growth, yes, we have to, what is our destination and what's our journey, right? The quality of the destination will depend on the quality of the journey. And we definitely need to start looking beyond GDP, because it's completely flawed in terms of not taking into account generational effects, not taking into account distributional effects within a country. It's basically not giving us a real picture of where our country is going. And we need to define growth in different ways, and that will also help us to come to different choices and to actually give people different perspectives on the choices that we have, because we don't really have a clear picture now, including all of the costs that we basically push forward to other generations or other parts of the world.
Ricardo, it seems we could maybe in this room agree what needed to be done, but to get it done, and to get it done while there still is time for getting it done, how could EIB play an even stronger role in speeding up innovation in Europe?
Look, the EIB can play an even stronger role in displaying with initiatives like European Tech Champion Initiative. That was a very clear, concrete example how to do more in the venture capital world. We can do more, and we are doing more in supporting REPowerEU and bringing up our REPowerEU package that will increase our funding every year from 20 to 30 billion euros per year for energy. But to do more, I think that the key here is that we agree on what is the end. And I'm not sure that we all in this room agree. For instance, from the presentation that that you did. Okay, so, and that is a key question. What is, the example of the car is beautiful, because we always want to run faster. And we need to change our minds. We need to run fast enough at a safe speed, but not necessarily faster and faster and faster. And that's the mindset, the change that we need. Of course, we can change from a GDP to other type of indicators, but it's not just the indicators, it's the mindset, is thinking how we can produce sustainably and value the resilience, value the sustainability, and not just growth, more employment, more wages, more profits. That's what is driving and still driving the markets. And
but sorry, Ricardo, if we change the indicators, would that not help changing the mindsets and the thinking?
I think that it helps, but I don't think it's an end by itself. It's a means to an end. And
so who should start the new circles?
So who should start the new circles? I think it's the way we in Europe get together and decide on our common future. European strategic autonomy. We have more and more, as we speak about European strategic autonomy, forget about the open. We start speaking about strategic autonomy, about doing everything in Europe. That's not the way. We'll not be able to do it. We don't have the resources needed to do it. And the way to have an open strategic autonomy is by doing it with the others. The strategic autonomy is not by being dependent of ourselves only. It's about not being independent from nobody, including from ourselves. This implies that we need to look at other parts of the globe that we can invest in and work and leave value there. Because if it's about just invest, extract lithium or cobalt or wherever in Africa or in Latin America, bring to Europe, look, it's a extractive economy. It's not oil anymore. Okay, it does not create greenhouse gas emissions, but it's extractive. It's not sustainable. If we think about living in 30 years, the way we live today, consuming the same amount of energy, it will not happen. We will not be able to produce so much energy. We need to invest in energy efficiency and consume less. And that's the important part. When we speak about the heat pumps and the heating, large part of the response comes from energy efficiency, from the way we build our buildings. If it's about installing heat pumps to burn something to produce heat, we'll not get there. And I think that's the key change in the mentality. Keeping the quality living standards, but be aware that we need to consume less and to reutilize more, recycle critical raw materials, and have an open economy where we benefit from production in Brazil, and Brazil benefits from the technology we have in Europe. That's the only way of strategic.
Thank you very much, Ricardo Felix. Now we have a lot of hands, and now I will ask you to note down. You will get the floor before we end, but I would like to take a number from the plenary now, please.
Good afternoon. I'm Wouter Vermeulen. I lead sustainability and public policy for Coca-Cola in Europe. Since this session is about recommendations, I'd like to bring forward an idea and then see what the panel makes of this. The role of nature-based solutions. Nature-based solutions can actually mitigate 37% of the climate impact mitigation needed between now and 2030. So nature-based solutions are about reforestation, restoration of wetlands, of rivers, of lakes. We work extensively across Europe in doing this with WWF to protect the Danube. We know from experience that it works. We have examples of where actually farmers start to support nature restoration because wetland restoration has benefits for flood protection. So the issue is how to scale this up. So the questions are like, how do you see more financing coming into nature-based solutions? And would you agree that looking at the next mandate in climate and environment policy, we need to push for more importance and more support for nature-based solutions?
Concrete question. We will take the microphone up here. Yes, please.
Marisa Monteiro Borsboom here with Women in Tech and always with my citizenship very well put. I'm in the Netherlands, but I come from Portugal. So I saw the two Europes with my own eyes. And I know for a fact that what works in one doesn't work in another. If the quality of the journey is important, I think the quality of the people is important. And Europe is not producing active citizenship. Policy needs to stop being patronizing. We need to stop saying the citizens. Policymakers are citizens that for a short period of time are able and have the honor to serve their society. We have the best human talent educated in every time in history. When do we have the courage to say that experts are not only the ones chosen by politicians, that every citizen in Europe is actually an expert in so many things, and we are not children. So for me, and that's my own contribution, very uncomfortable because there's always the voices in the room that nobody wants to listen, but is also to push myself in the uncomfort saying, we are the people, for the people, and we need to find solutions. And I feel always very uncomfortable when I hear resistance. How can we, because there are resistance. For me, this is imposing a mindset. Mining will be causing huge problems, but then the oil and gas are the bad guys. The power of narratives, of what we're saying to each other, is a problem if we want to change the world that Bella so well told us. That's what we need. We also need human conversations, and we need to forget sometimes I feel like we are in a Hunger Games movie where cities become the almighty, and in Portugal, the rural ways of life, they are so much more sustainable. I was raised in the mountains. I didn't even have a trash can. So maybe the new ways of living, the wisdom of the people need to come to the table, and we need to be the citizens of the 21st century that don't need to be having kings and politicians tell us what we need to do.
Thank you very much. Clear message from you and your neighbor. Yeah.
Yeah, hello. Marek Havrda, Deputy Minister for European Affairs, Czech Republic. I will take us back to something much more mundane, to money. And this is the proposal that I would like to be considered when thinking about the next mandate. I think we need to do much better analysis in terms where we invest. So I would like to envisage cost-benefit analysis across the board with the global consequences. So we understand where the money is playing the most important benefits. It goes to make sure that the global south is using best available tech for the production of concrete and steel, which will be needed there. That the global south, and as well us, using the best tech for mining, which will be needed there for the transition. That the money is used for the natural based measures, as was mentioned. So we need to put this together, not at the level of the EU. We need to put this together at the level of the globe and understand where we invest. It's clear that we need to have, we are the forerunners, and we should maintain the position. So this means we first invest in the solutions here, then we scale them globally. But we should make these calculations taking into consideration the both steps. The first one, developing the solutions, so for example, hydrogen. Second step, making sure we scale it and we make sure that it is used by the global south. So I would like us, maybe going beyond GDP is maybe too far-fetched, and there's been lots of work. I've been involved in that work for years, here in the Commission, somewhere else. This is quite simple. We have the methodologies. We can do it. I'm sure the EIB could be a good player to cooperate with on this. And we could produce that and to give it to the politicians when you're designing about how we distribute the future budget on fighting the climate change.
Thank you so much. We started late, so I will also run 5-7 minutes later maybe. I'm not sure we can have time for everyone, but we'll take 2 more before you get the floor up here. First, down there in the white shirt. Yeah, please.
Thank you. My name is Laura Sullivan. I'm from We Move Europe, a campaigning organisation. And speaking of human conversations, I had 2 very human conversations in the last couple of weeks. One with a woman called Irene, who's in Cáceres in Spain, and another with a woman who's called Bojana, and she is in Serbia. And we worked with Bojana and a number of movements in Serbia to try to stop Rio Tinto from grabbing land in the Jadar Valley. And we succeeded preliminarily. And they were very scared about what's going to happen to their community, the displacement of people, and the impact of the mining on their lives. And they are now part of a much bigger coalition as a result of this effort that is now saying the Critical Raw Materials Act has to stop because it is not coherent with the EU's values or priorities, namely green, fair and social Europe, or promoting peace and stability in the world, because we will continue through this Raw Materials Act to extract from the Global South. It will be no less, and we will step it up in Europe, so it's going to become a bit more awkward in Europe, people. And if you want to learn more about this, we launched a campaign about this today. You'll see it on the website of We Move Europe, and there's an excellent podcast by EU Screams that talks about this. I think it's time to pause on this act and say, hang on a second, answering this question, we are completely contradicting our values and our priorities right now.
Thank you very much. And you have been patient, waiting for a long time. Here at this table. Yes, please.
Sorry. I've been quite uncomfortable
and your
with.
Name, please?
Oh, sorry, Nicholas Bryan. I'm creating a startup to solve the waste crisis. I've been quite uncomfortable with some of the talks. We are very much thinking in a linear economy, right? And each of us is throwing 300 kilos of waste every year. 70% of this could be recycled, shouldn't be recycled, should be recycled, is not recycled. So before having these very grand debates about how many smelters we should open up and how many mines we should open up, maybe can't we just have a debate about how we can have the best resources in the world, which are the resources that we do not use or have already used? And I would be very interested to hear your point about how we can, foster a circular industry rather than a very linear industry, and learn from the lesson from the past.
Let's have some brief reflections from up here. I think there was one question of better cost-benefit analysis. Maybe, Ricardo, that is natural that you will take that. And then this circular versus linear, and maybe also the human resource Stintje. And then there was also a specific question to nature-based solutions. Stintje, you already have the microphone ready.
Yes, so absolute nature-based solutions, yes, we should use that much more than we currently do. So I hope also in the context of the fact that we need to start focusing on both adaptation and mitigation, we will be looking to work with nature instead of against it as we've done for so long. Then on the question of a more circular economy, I've been working on this for 10 years, so I mean, it's a comment to my heart. And if we look at the tripling of renewable energies and the fact that it will need up to 6 times more of these materials, we will not be able to just do that by recirculating what's already in use now, because the volume is just too small. That is why we also have to look at design and also have to look at demand and really have to look at the system behind. That's why I mentioned transport. If we want to provide every person with an individual EV, we will need to mine the world, right? That is not a solution. The solution is actually to not need a car to bring your kids to school, right? So we need to look at all parts of the system. That's the only way in which we're going to make it fit. But we will not make it fit without some need for new materials. The demand globally is going to go up. So we will also need to define those mechanisms to, when we do have to mine, to do that as responsibly and as sustainably as possible, which will never be fully clean. But we cannot ignore that that is also needed, Laura, unless you have another solution for how we're going to go through this energy transition and transport transition when we've taken all other measures. Right? So I think that is also something that we really need to take into account. Thank you. Ricardo.
Thank you. Starting by the nature-based solutions, I think most of the questions that were raised boil down to one question, which is pricing, internalizing prices. We need to have internalization. At the existing market prices, without internalization, we'll never find a way to decarbonize. On nature-based solutions, we need to put a price to the ecosystem services such that the nature-based solutions can deliver something that is a model that works from a perspective of finance from an investor and from a financier institution. And if you have this, the money will flow there. If you have nature-based solutions that are simply prototypes at very small scale, they will never be interesting enough such that resources flow there. We need to have scale again, and we need to have the appropriate carbon price. Otherwise, the appropriate price for carbon capture, otherwise the resources will not flow to the right place. On democracy, I think it's a key question, and I fully agree. Politicians are not. This is not a job. It's a service that we pay, that we do for a period of time, and it's an honor, and not a job for life or for a period. Let me tell you that the democracy question is critical. In our climate survey, the replies that we get from people is that people is able to accept, the citizens are able to accept some sacrifice to live in a more sustainable world. The point is how to move from the individual opinion in a survey to collective action and decision. And that's where not politicians, but democratic institutions need to bring everybody together and go for solutions for the problems that are supported and done by the citizens. And that's where things get difficult, because everybody wants to have a trash bin, but not at my door. And that's the problem that, that needs to be solved. On the Global South, well, the way is not to produce lithium or hydrogen in the Global South, bring to Europe, and produce everything in Europe. This model will not work. This is neocolonialism. We need to have a model where we produce in the Global South as much as we produce in the Global North, and we trade, and we produce where it's better, where it's more efficient, where things can be done. And of course, there is competence in Global South, there is competence in Europe, and there's a way of organizing this trade, and that's where we should go. Okay. To conclude on critical raw materials, on the IB, for every project we implement our European, our social sustainability framework. This ensures that all the projects are compliant with the best standards. They are more expensive. Yes, they are more expensive than producing in some parts of the world with no respect for human rights, no respect for environment. But again, this needs to be internalized. This needs to be in the price in some way such that the competitiveness cannot be achieved by social or environmental dumping. And on recycling, yes, of course, we need to extract critical raw materials. The amount in the market is not enough, but we need to have recycling such that in 20 years, we need to extract a minimum amount just to sustain the ones that existed. But this technology needs to be developed.
Good. Before I have a final question for our panel here, let's try and have time for 2 more interventions. You down there, yeah, you have been patient. Please, the microphone is just behind you.
So thank you very quickly, and actually connected to my colleague before me. I was going to talk about the waste issue. So my name is Jimena, I work at Dow. I'm originally from Argentina. I'm based here in Europe. Definitely something that Europe has is waste in terms of resources. So my question was on how we could better take advantage of this. There's clearly a lot that needs in terms of infrastructure and more investments in infrastructure. I wonder if the framework that Europe is proposing today is enough to create an attractive investment market for these type of solutions. At least in our view, definitely having waste as a resource, it's a way to phase out all the fossil-based raw materials that we're using today. So we're working on replacing oil and gas with waste and bio and others. So basically my question is, there's a lot of policies that Europe is proposing today that keep seeing waste from an end-of-life perspective and not really seeing waste as the first stage of a new cycle, like of a new production chain. So what could we do better? There's very specific examples in European policy that seems to be going against circularity of plastics, for example, and how we can make this more attractive so that capital really goes to this as one of many options in circular economy, of course.
Thank you. And the last one who will get the floor from the plenary is Bella, please.
I think someone quite a while ago mentioned it's too far-fetched to talk about redefining GDP, and I just have a question for Ricardo, which is, I mean, I'm genuinely interested to know your resistance to redefining GDP when you talk about how important it is to change the mentality. And I think our mentality is defined by what we collectively define as success, which right now politically is GDP. So I'll be interested just to, it really doesn't deserve a clap. I'll be really interested to know why you're resistant to it. And also, you described it as a means to an end. Could you clarify what that means?
Very specific questions to Ricardo, and then if Cynthia will answer to that question that we heard about waste. And if both of you, in your final reply now, would also sort of say, when we look towards the next EU mandate, what is the most important recommendation that you can think of when it comes to aligning our climate goals and industry development in Europe? So, Ricardo, if you start.
Okay, I can start. I don't have any resistance in redefining GDP by itself. The point is how to discuss economic policy, and GDP has played a key role for many, many years. I think that the question is how we measure GDP, know how we define GDP. And this is an important question that we can discuss. Sorry, then how we define success? We define success by having a number of indicators that you need to look at. For instance, using the existing indicators that I don't have resistance to reform, you need to look at GDP, definitely, at GDP per capita, so how much income we generate per person, and how the income is distributed across the society. That's the key. It's that we generate the income, and that income is distributed in a way that is commensurate to the needs and to the contribution of every citizen to the production of this value added in the society, such that everybody can have decent living standards based on how much everybody contributes to the society as a whole and not individually by itself. And that will be my long answer to the question on how you define success.
And your main recommendation on the topic for the next EU mandate, which barrier would it be most important to remove or to change?
Well, I always keep insisting on the need to look at capital markets union. I think it's the biggest barrier that we have to the development of Europe, is the limitations to have a capital market that allows resources to flow where they are most needed. And every time we spend all the time comparing Europe and the United States and saying, oh, United States has this, they have that. Well, the biggest financier of venture capital innovation in US is life insurance and pension funds. In Europe, you don't have these institutional investors. Everything is intermediated by banks, and we have limitations to risk-taking. So we cannot innovate when we, at the same time, we want to have the safety and taking the risk of innovation.
So more risk willingness.
More risk appetite.
Stinja?
So much that I would still love to say, but time is up. Anyway, what could we do more on the circular economy? Definitely we could do more with the eco-design directive, with producer responsibility, but overall we need to change the incentives. And if we change the incentives, we'll get a different market structure and we'll get a different use of our resources. And we could say that the problem is that Europe's economy is very inefficient. We could also say that that's the advantage. There's still a lot of low-hanging fruit, but we really need to change the incentives to do that. So my recommendation would be take a systems approach. Change the incentives to make sure that we avoid, shift and improve the way we use energy and resources. And notably, my second recommendation is look outside. Europe is only a part of the puzzle. We need to look outside. What's our footprint outside of Europe? That's maybe the negative side of it. On the positive side, when we think about climate change, where's the biggest bang for the buck? Right? Africa has, I think, about 40% of renewable energy potential. It receives now less than 3% of global investments. And that number has actually gone down. That's not the way in which we will get to speed and scale which we need. So clean your own house up, change the incentives, and look outside.
Okay, I think that's a fine place to end. And relating to what you have just been saying, I can remind you that the next session, the session starting at 4 o'clock, will be on growth. Growth, how, which kind of growth, so many of these aspects can continue. Thank you very much to our panelists. Thank you very much to Bella. Thank you very much to your many questions and comments. Thank you for now.